signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber program signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber Programme Sound. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly.
That's us live now, Chair.
Okay, good morning, members, and I now declare the meeting open to the public online. This is the 64th meeting, actually, of our Health Committee. And I'd like to welcome all of members who are participating today by video conferencing in order to maintain the social distancing guidelines that are in place as a result of COVID-19. And I appreciate your adherence to that. And can I remind all members about the protocols regarding the use of electronic devices? So, members, no apologies have been received by the committee office. Have there been any apologies to give at this point? No, thank you. And okay, moving on then to chairperson's business. And I suppose just to start this morning with I suppose, I'm not sure if members have had a chance to hear, but there are some very concerning figures emerging this morning in relating to waiting lists for CAMS assessments and appointments. And I think that is clearly of huge concern. Your heart would just go out to the family that was featured, but every family across the north who are in that difficult situation, and some of whom, for whom the time is simply too long, and they don't manage to be able to get to the appointment for whatever reason, and that is devastating for those families. So I wonder what members, and it strikes me as a kind of very similar to the situation we're seeing with autism, and a lot of these services now are coming under serious pressure, and people simply cannot wait for these appointments. So would members be content to be right to the department and ask them to provide an update to the committee in terms of the waiting lists and the missed the missed deadlines situation broken down by the various trusts? And I think that would be very useful. We are very conscious, members, that we are putting a very particular focus on mental health the week after next, which is Mental Health Week, and it would be, I think, useful to have those figures in front of us as part of that consideration. And also just to note that we have made a particular focus of children and young people's mental health for that week, and I think that's a reflection of the committee's concern, and I think therefore it's very relevant and important that we get those figures. So I see members' agreement with that, and thank you for that, members. The only other item today that I would have. Sure. Go ahead, Orlia. Yeah, sorry, go ahead, Orlia.
Ask a quick question. I know that we were talking about this when I don't know if we're in closed session, when we were talking about the Fort Work programme the other week. See the session that we're doing that week, that Mental Health Awareness Week in the committee. I know I had suggested at that stage about, even trying to get representatives from the trusts to come to that session in the committee. Now I know we're going to be tight for time, but I mean, that was one of my concerns around those waiting lists. And I mean, like the figures we heard this morning on that interview was shocking around the Belfast Trust and those CAMHS waiting lists. So I don't know if we would have any time or, if we could slot that in. But I mean, I think it would be useful. And even if, if the chief executives or if it's the director of the mental health services in each of the 5 trusts, if they maybe can't come physically to the committee, I think that, as you said, we absolutely need to have that detail around the waiting lists and people that aren't being seen in a timely fashion. So I don't know if we could facilitate that, or if it's too tight.
Yeah, thank you, Orlia. I'll just go briefly to Clerk just to check, would that be possible, or has there been anything been able to be arranged in relation to that, Clerk?
We will certainly have a look at that, Orlia. We have got a programme that we're going to discuss later on the Forward Work programme for that week, which includes a various number of groups, including the Mental Health Policy Group and a couple of other groups that have shown that have written to the committee to highlight. But I'll look at the issue of the trust. We do have the Minister up on that week as well, so we can raise that issue. But I'd see what we can schedule into that week, because it's a pretty full-on week at the minute, and we'll try and get and have a look to see what we can usefully add into that week.
No, that's fair enough.
Okay, thank you. Thank you, Orlia. Okay, thank you, members. Go ahead, Pam.
Yeah, Chair, just to say I completely back that call as well, and what Orlia is saying. I think as much scrutiny as possible that we can add into this particular subject is absolutely vital. So I'm just wanting to say that I back that call. If we can make that fit in, I think we should make it fit in.
Yeah. Thank you. And I think, the heartbreaking thing about this is, for me, is that we constantly promote a message to say to young people and everyone else, it's okay to not be okay, and speak to someone. And these young kids, by and large, have spoken to someone, have reached out for the help, but the help hasn't come to them quickly enough. And I think that's a massive concern. Okay, thank you, members. I think that we're in full agreement on that. So thank you very much. The only other item I wanted to flag to the members' attention was a meeting that I had done this week in relation to health inequalities with one of the overarching community sector, CDHN, and just to say that they had flagged that they would like to brief the committee at some stage in terms of their concerns around inequalities and how they're impacting out in communities. So I anticipate that they will be at some point writing to the committee to see can they get in front of the committee to brief us on the issues that they see emerging at the present time. Okay, thank you for that, member. So moving on then to the draft minutes, and I refer you to the draft minutes of our meeting of the 22nd of April, which is at tab 3.1. Are members content with those minutes? Yeah, members content, and thank you. Are there any matters arising? There's no matters arising from, as far as I can tell, from those minutes. Okay. Moving on then to our first substantive briefing this morning then, members, I refer you to, this is the departmental briefing on budget 2021/22. I refer you there to the department's briefing paper, which is a tab 5.1 of today's pack, and to the Hansard of the previous budget briefing, which is a tab 5.2. I can advise members that departmental officials are here today to brief the committee on the department's budget for 2021-22. And I would now like to welcome by video link, firstly, Miss Bridget Worth, who is Finance Director. Good morning, Bridget. Are you able to hear us?
Morning, Chair. Yes, I can hear you just fine, thank you.
Yeah, and we're hearing you there as well, Bridget. Thank you.
Good.
We're also joined by Mr. David Keenan, who is Head of Financial Planning. Good morning, David.
Good morning, Chair.
Yeah, hearing you great there, David. Thank you. Miss Preeta Miller, who is Director of Infrastructure Investment. Good morning, Preeta, and can you hear us?
I can. Good morning, Chair.
Thank you. And Miss Ciara Dolan, and Ciara is Director of Transformation within the department. Good morning, Ciara, and can you hear us?
I can hear you. Can you hear me?
Yeah, we're hearing you there, Ciara. Yes, thank you. So, Tafáilte Roa Balig, you're all very welcome to this morning's committee meeting. Thank you for coming along, and we look forward to your briefing and to a question and answer session with members in relation to budgetary issues. So I will go back to you, Bridget, then. Can you go ahead, please, and invite or outline how you plan to invite the committee, to brief the committee this morning on these on this budget?
Okay, thank you, Chair. I'll start by making some opening remarks on the resource position, and then I'll hand you over to Preeta to comment on the capital position. As ever, David and Ciara are here to assist with any queries on the resource side and on transformation respectively, but they'll not be making opening remarks this morning, if that's okay with you.
Yes.
Thank you. So you'll see from the paper that there has been no movement in the actual figures for the department between the draft and the final budget. We're still anticipating additional funding of 495 million, and the breakdown remains unchanged. Whilst I appreciate the constraints on the overall funding position for Northern Ireland, I would nevertheless like to reiterate the point I made when I came before you in February, which is that only the 52 million of Agenda for Change pay funding has been provided recurrently, and that represents a recurrent increase of less than 1%. And just to put that in context, in the 2020-21 financial year, the department received some 400 million of additional funding, of which 344 million was recurrent. On a positive note, we've had the amount of our in-year allocation in relation to safe staffing confirmed at 20 million, and we're also expecting a further 50 million for additional costs we've identified for our COVID-19 response to be provided in year. However, both of these allocations are likely to be non-recurrent, which will be a particular issue for the safe staffing allocation, which is mainly needed to fund staff pay and hence will represent an ongoing cost to our budget. As you'll be aware from my previous briefing on the draft budget, we're also dependent on non-recurrent COVID and transformation funding to mitigate recurrent pressures that were previously included in our requirements to maintain existing services, to meet some new inescapable pressures, and to fund some of our new decade new approach priorities. Whilst we've restricted the amount of non-recurrent funding we've used in this way to around £250 million, with our estimate of pay and price inflation running at around 150 million, we will require an additional 400 million above our current baseline in 22-23 just to stand still. And when I say stand still, I mean continue to deliver a health and social care service that has waiting lists that were recently described by the Minister as dire and appalling, and where we're unable to meet the growing needs of our ageing population. Turning to the detail of the paper of what the allocation will be spent on, it's important to recognise that many of the things highlighted in the paper as funded were already being delivered at 31st of March 2021, but using non-recurrent funding. So whilst the spending is additional to our existing baseline, in many cases citizens are not going to see any additional services. Taking, for example, one of our transformation projects, multidisciplinary teams in primary care, under NDNA transformation in your paper you see an investment of 22 million. You could be forgiven for thinking that this will significantly expand our delivery of this service model into new areas. In fact, this is just needed to continue the service we were delivering from last year's non-recurrent transformation funding. So effectively, if we'd not received this funding, we would be looking at having to scale back what's already there. And that's the challenge we face with the level of non-recurrent funding we have. Every year we need that allocation plus inflation before we can even start to increase delivery. You've probably noticed that the paper I've presented you with today focuses on the positives, on the things we can do with our budget allocation. But it's also important to recognise that there are a lot of things we would like to do that this budget simply does not provide the resources to fund. The Minister has recently announced his rebuilding plans for the health and social care system, which will include strategies for elective care, cancer and urgent and emergency care. He's also consulted on a mental health strategy. Given our current financial position and the outlook for next year, it will be extremely difficult, to say the least, to achieve effective delivery of these plans. Without the certainty of additional sustained funding over a number of years, these plans will not be feasible, and the improvements in vital services we all want to see will not be possible. You are all also probably going to ask me questions on whether other important services will be delivered or improved, and my answers in most cases will unfortunately probably not be what you want to hear. Whilst I am naturally very concerned about the 2021-22 financial position, I'm perhaps even more concerned about the likely position in 22-23. Whilst welcome, the temporary COVID funds we've received are helping to mask the scale of the underlying financial pressures that are building up across our services that I outlined earlier. The overall impact of the COVID-19 pandemic will be felt long term, whilst the additional COVID-related funding we've received will be short-term, and we currently have no sense of how these pressures will be addressed in the future. So with that in mind, I'm really not looking forward to coming back to you later this year to talk about the 22-23 budget. As I said earlier, I expect that the department will need £400 million just to pay for what we're doing today, so I know the chances of good news are slim. And on that note, I'll hand you over to Preeta to talk about the capital position.
Thank you, Bridget.
Thank you.
Thank
Go
you.
ahead, Preeta. Yeah.
Thanks, Chair. So the final capital budget allocation for 21-22 has been confirmed as £326.5 million. This is a welcome 10% increase on our 2021 opening budget. Within this, we've received £3.6 million of COVID capital funding. The ongoing and key issue remains the affordability of schemes in future years, and without additional resources in a multi-year budget settlement, this one-year budget again means that the department cannot commence significant new investments that will continue beyond the 21-22 financial year. This applies to investments we would wish to begin across all of our services, for example, in mental health, increasing emergency theatre capacity, investing in our emergency services, diagnostic equipment, and primary community care facilities. The proposed allocation will, however, enable us to take forward those priorities that we regard as inescapable, as well as continuing to progress our flagship projects, a small number of critical new projects, and provide regular and ongoing investment to the Health Service and Northern Ireland Fire and Rescue Service for fleet and estate maintenance and ICT. There have been some changes to our profile since our February paper to you, which has resulted in the reallocation of £13.4 million to emerging pressures, of which £11.3 million has been allocated to maintaining services in order to prevent further deterioration in the estate. These reallocations are set out in detail in the various sections of your briefing paper. And with that, Bridget, Ciara, David and I would be very happy to take any questions you have on the information provided. Thank you.
Okay, thank you, Preeta and Bridget. And just remind all members and panel that when you're not speaking, if you can kindly remain on mute, that helps with the sound quality. So I suppose a few questions in more in general terms. First of all, Bridget, so once again, we're looking at a one-year budget, and we know that we know the need and the pressure there is on moving to more of a multi-annual budget situation. In terms of long-term planning and that longer-term budgeting, what would the key priorities be, and what plans do you currently have? So you must be forecasting even if you don't have the budget. What are your priorities? What would your priorities be, and what are they over the next 3 years in what would be a more realistic budgetary situation?
Okay, it might be useful if I hand over to Ciara after making a few initial comments to talk about the sort of overall strategic planning that's going on in the department at the moment, if that's okay, Ciara. But I suppose from a budgetary perspective, I've noted in my opening remarks there that there are a number of key strategies being developed around cancer, elective care, mental health, and urgent and emergency care. And I suppose we're looking to ensure that we understand the level of costs that would be associated with delivering those effectively as those strategies are developed, and they would form some of the key planks in our financial planning going forward. Coming out of a COVID pandemic, we're obviously keen not necessarily just to reproduce what we had there in the past. So there's an element of needing to go back to the drawing board a little bit in terms of the future developments that we would like to see, rather, they're not necessarily the same as what they would have been before the pandemic. But Ciara, is it okay if you say a few things about strategic planning?
Absolutely. Chair, happy enough I take that on.
Yeah.
Can you hear me okay? I think there's a wee delay. Yes, in terms of just, prioritisation for the next number of years, as Bridget says, we're not clear and we won't be clear on what the financial position is, but I'm undertaking a piece of work at the moment in terms of looking at, the work that we began in transformation, and looking across, what the future of the system needs to be. And I much of what happened in the transformation space over the last sort of 4 or 5 years has become sort of the building blocks of what we need to do going forward. And the problems that we had pre-COVID are no less problematic. In fact, they're probably more problematic. So in terms of looking forward and rebuild, I'm pulling together the main sort of areas under elective care, under children's services, under mental health, under secondary care. And so working, Chair, that there's nothing that's any more important or less important in the space of health and social care. So I'm working to pull together, subject to the Minister's approval, a framework which pulls together the key transformation activities like the MDTs, like the day case elective care centres and many other things, with the work that we're undertaking in rebuilding, the work that we're doing in to review imaging and pathology and, deliver mental health services, to put together a framework and an action plan for the next number of, for the next year initially. And, the longer term aims will be further developed, I suppose, when we know what the financial position is going to be, what the future impact of the pandemic is going to be, and I suppose how far we can get with the resources we have. So I'm not sure that answered your question necessarily, but I mean, I think what began in transformation is being built on, and we're continuing to do that in the space of rebuilding.
Yeah, and I know there are tremendous pressures on transformation, on waiting lists and all of that. One of the things that I did notice absent from both Bridget and yourself, and it's an issue that's been raised by the committee before, is around the whole area of health inequalities and how we are addressing those significant in everything else that we're doing. So when we're allocating budgets, when we're dealing with transformation, how are we? So what plans have the department in terms of budgeting? What money or resources being allocated to dealing with the issues of inequality?
Well, Chair, I thought that you might ask me on that, because it's been an issue that we've been looking at as well, and most recently actually discussing with the Minister and the Transformation Advisory Board in terms of health inequalities and how we address them, because we know the pandemic has had and will continue to have an impact on that. And just prior to the meeting, and I was thinking about this, the presentation that we brought to the Minister, it was a presentation that the PHA had delivered, and it said health inequalities. And I know that you've asked for a briefing on health inequalities, because really the work of making life better is where health inequalities is looked at specifically. But we know that the causes of health inequalities are so much broader than what we deliver in the health service. And the presentation recently pulled that out in terms of, the impact of employment, the impact of disability, the impact of, urban and rural, where you live. And, the presentation actually, brought it home to me again in terms of, the conditions I've got it written here, the conditions in which we are born, grow, live, work and age all impact health inequalities. And actually, it's only 20% of the impact of health inequalities is determined by the health services that are there and the access to the care that you have, albeit that's a really important 20%. I suppose it's our job
and just in relation, even taking that 20%, the Department of Health here is obviously a massive department in terms of budgeting. So even taking that 20%, what percentage of the department's resource is being allocated or directed towards dealing with these absolutely unacceptable inequalities?
And to be honest, Chair, I think that from my perspective, it would be wrong for us to say that we have an amount of money that goes towards dealing with health inequalities. Everything that we are doing should be tackling health inequalities. And just from my perspective, in terms of transformation, Delivering Together is based on tackling health inequalities. I mean, that's mentioned in Delivering Together specifically. So, for example, the rolling out of the MDTs, there's £22 million in it this year. And MDTs is a regional programme which is looking to make sure that there's access to those services right across Northern Ireland. And despite the fact that we don't have the money to grow it the way we would have done, there is slight growth, very slight growth in trying to move that forward. And even last year, when we were moving transformation money around and reallocation, we gave more money to try and push that out. The day case elective care centres are a regional approach to making sure that there's a regional access to day case elective care, so that you weren't having that postcode lottery that we know is a problem with health inequalities. I mean, there's £1 million. There's lots of examples.
Okay. And then aside from the budget, and so there's not a figure identified, and I think it will be useful to hardwire this into everything that's being done. But in terms of measuring that the funding that is being spent or making its way to inequalities, what are the department's metrics for measuring to ensure that inequalities are being addressed, and this is not simply increasing or drifting? What measurements are being used?
I suppose that's in the colleagues in population health and that look after making life better will have those exact metrics, and we can come back to you on that. But again, Chair, I suppose it's everything that we're doing should be tackling those health inequalities, and those measures will be associated with the Making Life Better strategy.
Okay. I think I have no doubt we will continue to return to this. I think it's a key issue for the committee in general. Anyway, I'll move on because I'm keen to get to other members as well. In relation to the very long waiting lists that we've all know are absolutely unacceptable and dire and atrocious, and simply must be tackled and got to grips with. But the Minister has outlined the cost of addressing the very long waiting list that we see. So can you clarify for us the amount of funding going towards this in this financial year and sort of break that down for us? And then what are the plans in future years? And that's probably Bridget, I would think.
Yeah, no, thank you, Chair. So I suppose in addition to the provision of elective care in our trusts, which, as we know, has been constrained and will be constrained at the start of 21-22, we have set aside £40 million of COVID funding to addressing waiting list initiatives and other elective developments. And based on our experience in 2018-19, when we invested £30 million of non-recurrent funding in elective care waiting lists, that resulted in around 120,000 additional patients being seen or treated. So we're estimating that in a region of 160,000 patients will benefit from this investment of 40 million in 21-22. I mean, that will depend obviously on the case mix and the complexity of those cases, but that's the kind of scale that we're expecting. It's not possible at the moment to forecast into 22-23 what we'll be able to do. That will obviously depend on the budget that's made available to us. When I've talked about needing an extra £400 million to stand still earlier in my opening remarks. That £400 million doesn't provide any additional funding for waiting list initiatives over and above what's already available within our trusts. So we are facing into a very challenging position into 22-23 and beyond in terms of that investment. And as I say, without the recurrent budget and the recurrent certainty of funding into the future, it's not really possible for us to plan at this stage or to give any comment on what might be deliverable beyond the current financial year.
So does that suggest no planning at all, Bridget, or are you working on assumptions? Are there assumptions you can usefully work from?
It's, as I say, it doesn't mean no planning, but it means we can't make any firm commitments because we have, as I say, I think £400 million additional funding over and above what we've got this year is already going to be a challenging ask for the executive in the context of probably a difficult budget position. Very difficult for me to say, probably difficult for colleagues in the Department of Finance to say in the absence of a Westminster allocation. But so on the face of it, if we only get £400 million additional funding in 22-23, we won't have any more money for waiting list initiatives. And in that context, it would be foolish of us, I suppose, from a financial management perspective, to make any firm commitments. That's not to say, as obviously our colleagues in that area will continue to work with independent sector providers and continue to identify potential opportunities. But it is very challenging in a scenario where you're saying, well, we don't know if the money's going to be there to have those engagements in a meaningful way, because, people can't say, oh, right, well, that's fine, I'll increase the capacity in my business. When we're not being able to give them any guarantee that that we will be putting patients in their direction.
Okay, thank you. And I guess other members may want to pick up on that, so I'll leave it at that. My final one then, Bridget, is around the agency, and it's linked to that issue because these are all interlinked, obviously, in terms of financial headroom. So we see a figure, again, a massive figure built in for agency staff and agency payments. We, I think, all agree that that's a problem and that the agency spending is too high. So what plans are in place, apart from budgeting to allocate to continue paying that level, what plans are in place to address it and to reduce it?
So we have continued, and you'll see that in the paper that there are a large number of financial commitments in here for additional training places, and that includes continuing with the 300 additional nursing training places that was part of our NDNA commitments. So we are continuing to train additional staff to address that position. However, it is a longer term solution. It takes time to train people, and I'm afraid you are going to get the broken record again a bit. It's very difficult for us to put more people into training when that requires long-term additional budget commitments. So I have non-recurrent funding this year. I could potentially go and make a bid for more funding for training, which is a big part of the solution to reducing the need for agency workers. But if I'm given money this year with no promise of money next year, I can't put somebody onto a training course because I need 2, 3, 4 years.
Yeah, no, I understand that, but what I'm trying to get beneath the skin of is what is the ambition of the department. So have the department a figure in mind as to when they would like to see or how much they would like to see this reduced by. That would then convert into potential funding being freed up to put into, say, waiting lists or other. So do the department have a plan within their budgeting department to reduce agency spend?
So, as I say, it is dependent on that supply of additional staff, and until that supply of additional staff is available to us, and it is around that workforce strategy that will make the additional staff available to us, so that the dependency on agencies. So I suppose my answer to you is it is the workforce strategy that is that strategy.
Yes, and that's key, and I do accept that's key. So then let me take it a slightly different way, maybe to make it easier. Maybe I'm not sort of getting it across properly. The additional places that have been put in place now, how much will that reduce the agency when they come on stream? How much will that reduce the agency spend by?
Okay, I don't have that figure with me today, Chair, so that's something I would need to come back to you on.
Because that would then give us an idea, if we want to drive down the agency spend, how much do we need to put into the training places element of it for the future?
I appreciate that, yes, I do, yes.
Okay, I'd appreciate you coming back to me with the figures. I do want to get to other members, so I'll leave it. And thank you very much, Bridget and Ciara, for those answers to me. So I'm going to go first of all to our Deputy Chair, Pam Cameron. I then have Ciara Hunter, Carol McKillen, Paula Bradshaw, and Jerry Carroll. That's the order I have it present in front of me there. So I'm going to go back to Pam then. Go ahead, please, Pam.
Thank you, Chair, and thank you, Bridget, Preeta, and the rest of the officials for your attendance at committee today. Obviously, there are serious concerns and grave concerns around the limitations of the budget going forward, and I would be very concerned around transformation or the ability to transform, which is really vital. So I wanted to ask around transformation first, and that was to what extent the single year budget is dissuading the departments and trusts from investing in transformative projects which may have recurring costs over a longer period. So that's my first question.
Ciara,
sorry, Bridget. I don't think it's dissuading the department. I think we are abundantly aware and more aware than ever before of the need to transform services. Given the ageing population that we have and the need to deliver more effective, sustainable services. So, we have been on a journey of transformation for the last since 2016, so almost 5 years now, and we're continuing to commit to that work. So, as I said earlier, to the chair, the significant amount of transformative activity that happened over the last number of years in the areas of elective care, urgent and emergency care, and primary care, right across the board, we have continued to continue that programme. Even in not having the recurrent money, we had the 200 million in 1819 and 1920, and we've continued to make the recurrent use of that despite significant financial pressures, and we've done the same again this year. And I'm undertaking a piece of work in terms of sustainability to say, we know that we don't have that money next year. We didn't have it this year, but we managed to find it through the COVID recovery money. But we don't know if we're going to have that next year. But so I'm undertaking a piece of work to say, look, how can we meet the cost of these significant transformation programs, that are emerging now in sort of wider rebuild programs, out of the recurrent funding sources that we have. But I mean, there's immense pressure, and there's savings plans that the trusts have to meet as well. So it's not an easy ask, but we can't step away from transformation because we know it's the only pathway to a sustainable service for the future. So no, it is challenging.
Thank you for that, Ciara. My next question was in around IVF services, and I want to ask if is the 1 million earmarked for IVF as part of the COVID rebuild? Is it related to existing service provision rather than implementing the NDNA commitment for further cycles?
Okay, I can answer that one. And I'm actually just scrolling to the part of my briefing that will give me the answer, if you bear with me a second. So around half of that funding is going to be used to fund the revised criteria that were changed in 2019. So that included expanding the age limit to include 40 to 42-year-olds in line with the NICE guidance. The remainder is going to be used to address the backlog in treatment as a result of the pandemic, so that when it's possible to increase the number of cycles as outlined in NDNA, there's not a backlog there already for women who want to access treatment.
Okay, that's useful too. Thank you for that, Bridget. Another question for you is around the cancer strategy. Like, how will the £5 million for the cancer strategy translate into service improvements and a scaling up of accessible services for affected patients?
Okay, so a significant proportion of that 5 million is funding ongoing transformation projects, so transformation projects that were funded non-recurrently previously, and around half of it is going towards the stabilisation of oncology and haematology services. That's as set out in the oncology and haematology stabilisation plan that I think was published last year, and that will enable a number of posts that are temporarily funded from that plan to be secured recurrently going forward to enhance stability in that area. And there's also funding in there for Macmillan clinical nurse specialist workforce, for fit testing in primary care, although that is subject, I think, to the approval of the Chief Medical Officer, and some other areas such as radiotherapy. And there's also a small amount of funding in there available to the new cancer strategy that's under development. So I suppose there's a range of things in there that 5 million is going to help to fund.
Okay, thank you for that, Bridget. And then my final one, Chair. Could you provide us, Bridget, with some more detail on how the projects were prioritised for funding under the COVID rebuild pot? Could you tell us more about how those projects were identified?
Yes, so as part of our budget planning, we had asked colleagues in the HSCB, commissioners in the HSCB and policy colleagues alongside Kira's team in transformation to identify funding needs. And actually at the time we were planning for a 3-year budget, so we were looking for the 21-22 year and the 2 years subsequent to that. And that sort of long list, I suppose, was identified as part of our early budget planning and formed the basis of our bids to DOF. Then when we got our funding allocation, we used that kind of long list to give us a sense of what proportion of funding might be needed in each area. And we then gave indicative allocations to our policy colleagues, and they worked with their colleagues, the commissioners in the HSCB, to look to see where they felt the priority areas were. And I suppose Kira touched on this a bit earlier. It's very difficult, I suppose, in health and social care to say that something is more important than something else. So we often end up, I suppose, funding part of everything in a lot of cases, but it has really been driven by that consultation with policy colleagues and commissioners on what are the most important things to be funded in each area. So that's really how that prioritisation has come about. And obviously then we would have put those recommendations to the Minister for the Minister to consider and endorse.
Okay, thank you very much. Thank you everybody. Thank you, Chair.
Okay, Pam, thank you. And going then to Chiara next. Go ahead, Chiara, please.
Thank you, Chair. Good morning, panel. Thank you, Bridget, for being here, and other officials. We had talked briefly there about our shared concern at the committee around CAMS and the waiting lists. They're a huge issue for young people struggling with mental illness, and oftentimes what we see is they're waiting for an appointment in CAMS, and then they must transition into adult services, and they're waiting there for an appointment as well. And this can be exceptionally detrimental for their well-being. Can I ask for clarification on whether the 4.6 million detailed here, which is invested to maintain psychological therapies, does that include CAMS?
I think we'd picked that up in a previous question from the committee. That 4.6 in itself doesn't, I think, include CAMS. I think that was it's stuff to the funding, it has been in place for a number of years, and it's to help people to come off benefits. So it is largely focused on adult psychological therapies, that particular 4.6 million. However, there is an allocation elsewhere in the budget for CALM specifically, although again I should stress I think it is to maintain the existing CALM service rather than us having any additional funding to allocate to it in this current budget settlement.
Okay, thank you, Bridget. And then just off the back of that, I seen that there's 3.5 million for mental health services as part of the New Decade and New Approach transformation. Is this earmarked for particular services? Can you detail them? And I know myself and other members have a key interest in dual diagnosis. So can you expand a little more detail as to where the 3.5 million will go?
Kira, do you have the detail on that?
Not to hand.
I have some detail here that may be useful. So there's three main elements to that. There is the continuation of the regional implementation of the suicide prevention strategy. So that's aiming to reduce the number of mental health patients' suicides by supporting multi-professional teams in the trusts. There's continued implementation of Protect Life 2 action plans, and there's also continuation of the Enhanced Mental Health Liaison Service, which was formerly RAID, which provides greater access to mental health service for patients and staff in acute hospitals. Again, I think those are three projects that started non-recurrently under transformation previously, and are this funding is enabling us to continue those into 21-22.
Okay, thank you, Bridget. Very important to save lives. Lastly, can I just ask a question around nurses' pay increase? And I know that the pay review body is still at report to come back, and hopefully will shortly. Like other members, I'm very hopeful that it will be more than 1%, as we have seen in other areas. So can I ask, where would this money come from, and has the consideration been given to allow for this in this financial year?
Okay, so we have a figure in here for AFC pay, the 52 million, and nurses' pay rises would be included within that. It is based on the recommendations of the pay review body, so that 52 million would be enough to deliver their recommendations. Should they recommend a higher amount than is currently being recommended, assuming that was funded through additional funding in England, we would get the Barnett consequentials of that into Northern Ireland. The problem we have is that because of the way our health service is structured compared to the way it's structured in England, Barnett consequentials aren't normally sufficient for us to meet the full cost of an additional pay rise for our staff. It's largely due to the way social care is funded here compared to England. And so there would then be an additional pressure at block level were there to be an increased pay rise. Now that would obviously be something for the executive to consider, whether they would fund that from within the block, or whether they would look to us to reduce some of our proposals that we've set out here today to enable us to fund it. So I suppose within what I'm presenting to you today, there isn't provision for an additional pay rise over and above what's currently being recommended.
That's unfortunate. I think what we've seen, over the past year within the pandemic is the devotion, the commitment from the frontline workers. So that's disappointing. But no, thank you, Bridget, for your previous answers there on mental health. That was helped clarify what I needed. Thank you.
Okay.
Thank you, Cara. I'm going then to Carol Nichillen. Go ahead, Carol Liddahall. So I'm just checking if Carol, can you hear us there, present?
Can you hear me?
Yes, we're hearing you now, Carol. Go right, Lana Ray.
Sorry, I'm just having internet problems. So, so the 52 million for the pay increase, that's clear enough. But what isn't clear for me is the agenda for change pay inflation at 40 million. And then the other non-pay inflation at 25 million. What are they to be spent on?
Okay, so a lot of our doctors and dentists would not be on Agenda for Change pay scales, and neither would our fire service and also civil servants. So the non-agenda for pay figures include provision for those groups. There's probably some others I've forgotten, and many apologies to those groups who I haven't mentioned, but it's really any of our workforce that is not on Agenda for Change pay scales, that funding is for them. In terms of the non-pay inflation, that is your sort of general goods and services going up in price as a result of underlying inflation rates. So, it's things that we buy for. It doesn't think. Sorry, drugs is the one that's coming to mind, but we have a separate provision for drugs inflation. But it's I suppose everything from cleaning products to medical devices, those sorts of things.
Okay, so can I just have a breakdown on the 40 million non-agenda for change pay and itemised beside each profession, and then the 25 million what the goods and services. Because I think when we're talking about nurses who are going to hopefully get an increase, and then we've got this whopping 40 million, I would just like to be curious to see what the pay increase is for the others. Sorry.
And that's absolutely fine. We can provide that. I should say some of it is the national living wage uplift for our care home and domiciliary care workers as well. So we're happy to provide a breakdown.
Okay, that's why I'm asking, Bridget. Okay, so could you tell me why there's only 600,000 earmarked for hepatitis C and contaminated blood products? What's that about?
So that is the additional amount, so that there's already funding in our baseline for the hepatitis C. You'll be aware there were additional amounts allocated in 2021. So those amounts are already in our baseline. So this is an increase over and above what would have been provided in 2020-21. So sorry, I'm trying to find the place in my briefing. David, do you have that to hand as to exactly what that's funding?
Yep, just hold on. Yeah, that's to cover the costs resulting from backdating payments for bereaved partners. This was announced in March 21. So that's costs that we've incurred in 2021. This is now additional requirement for 21-22 budget. So as Bridget said, that's additional to what we already have in the baseline.
Okay, and when you say bereaved partners, David, you're not expecting someone to be legally married, because we've already been through that.
I'm not sure on the detail of that. Sorry, Carol. But
no bother. Could you try
yes, it's something we could come back to you on.
Brilliant. I appreciate that. And so under the category of other, you've got 800,000 for prison healthcare. You've got 2.2 million for urology public inquiry. You've 1.2 for palliative care. There's no baseline or no figure at all for the neurology public inquiry that the minister was talking about. Not even an indicative figure. So what's the situation with that, please?
Just bear with me a second. There is funding in there for the neurology public inquiry. We just hadn't detailed it out. We have £500,000 set aside for the neurology inquiry, which is the amount that we are expecting to spend in. No, sorry, that's neurology services. Apologies for that. I know we have taken the neurology inquiry into account in putting the budget together. I'm just not putting my hands on the exact amount.
Okay, Bridget, I appreciate.
I'm happy to come back to you on that.
Yeah, it's just I want to make the point: the fact that it's not there, and which has been an ongoing scandal. Okay, and we're now looking at a third recall, and even given the fact that the minister had to come in front of the assembly to explain what's going on, and yet in all there's no indicative baseline there. It's quite disappointing. and I would anticipate that it would be in the region at least of the urology at 2.2 million. But I would just ask that you provide details. And the last question, Chair, I have is regarding the 1 million for cybersecurity and digital health and care, and also the 700 grand for nursing home inreach. So that in relation to the nursing home inreach, what is that to do, please?
Okay, nursing home inreach. Sorry, bear with me a second. So that will enhance and expand the knowledge and skill of care home staff to enable them to meet the urgent and critical care needs of residents. So the idea of that is to reduce avoidable attendance at emergency departments and admission to hospital. So I suppose it is to enable care home staff to be upskilled to better meet the needs of the clients that they're serving.
And that's fine, Chair, and I'll finish in this. I would just like to see some more detail. I mean, the district nursing figures are fine. Enhancing levels of senior nursing staff, I'm assuming that's career progression. But if I could see details on the enhancing levels of senior nursing staff and more details on the nursing home inreach, that would be greatly appreciated. Thank you very much.
Okay.
Thank you, Carol. And going then to Paula. Go ahead, Paula, please.
Thank you, Chair, and thank you, panel, for this morning's briefing. My first question is in relation to PrEP, the anti-HIV medication. And in March this year, the Department of Health put out a statement said that work continues to secure funding to support recurrent investment in PrEP. And I would just wonder where in the budget an allocation is, and if not, what's happening in that regard. That's my first question. Thank you.
Okay, I think there's again, just to sort of, I suppose, give committee members a sense just of the way the paper's been put together. We try to highlight some of the larger amounts and some of the key things rather than give you an exact list of absolutely everything that's been funded. There is £300,000, I think, built in here for PrEP into the overall allocation we have in our population health and health prevention area.
Okay, thank you. That's crystal clear. I really appreciate that. My second question is in relation to the safe staffing legislation, the issue that the Chair raised there around agency staff. In my constituency in South Belfast, you'll be aware there'll be a lot of people who live in HMOs, etc. And anecdotally, I'm hearing that there are a lot of nurses coming from Zimbabwe. And I am all for women empowerment and all those issues, and this is not a political statement, but I am concerned that gaps are being plugged in the vacancies for nurses by poaching nurses from developing countries who can ill afford to lose their staff. So I wonder to what degree that is continuing, and whether you can comment on that. But probably in terms of the budget, how much are the agencies who are actually employing these nurses, what cut are they taking of the money that's going from the Department of Health to them and then paid to these staff who are coming here from other countries? Because I would be concerned that the people who are most profiting from this are the agencies. Thank you.
Okay, and I suppose I don't have the exact information that you're looking for there, and in particular, I'm not sure to what extent nurses from abroad are coming here to work for agencies as opposed to coming here for a career with the Health and Social Care Service. So, I mean, that's perhaps one that would be better to take away and allow workforce policy colleagues to come back on.
Okay, no, appreciate that, thank you. I think the next one is for Ciara. Ciara had mentioned there, I think it was Ciara was talking about looking at the future of how the system has to be in terms of sort of the regional prioritisation of the list going forward. And I'm just wondering to what degree she is sitting on the Regional Management Board and how much there's that read across between what is the clinical urgency that the clinicians are saying needed for the surgery and how much she's feeding in there in terms of the realism of what budget is actually available. So it's just that relationship between departmental officials and the board, please.
Yes, of course. The Regional Management Board. It's the Rebuild Management Board. And on it, Paula sits all of the chief executives of the trusts. There's primary care commissioner, there is primary care, there's GP representation and surgeon representation, and then the chief nursing officer, chief medical officer, the chief executive of the Health and Social Care Board. So the whole system is represented on that. I feed into the Rebuild Management Board. Actually, next Wednesday, I'm taking a paper on a proposed framework and action plan for amalgamating the work of transformation with the new work that is, emerged out of Rebuild and the COVID learning, so into sort of an action plan for the next 12 months. So very much engaged, and I work very closely with Bridget in terms of how we fund that, what we can afford to fund, and that's taken into account. So the framework is a plan for the next 12 months that ultimately the minister will have to consider and approve. But it's an aspiration. We don't have the financial capacity. We know Bridget said that out very clearly at the start, but it's no less important to be looking at what we need to do and having those plans in place should the money arise or not.
Okay, thank you, Ciara. Maybe just as a follow-up and last question from me, Chair. It's in relation to the provision for long COVID in terms of everything from the assessment of diagnosis in terms of the allied health professional support, etc. Have you got an indicative budget of what you think that will be in the next financial year? And to what degree are you working with the Health and Social Care Board who are leading this sort of service configuration framework in terms of what the service will look like?
Okay, and Paula, working on developing cost proposals for services for long COVID or post-COVID syndrome, that work is ongoing. Unfortunately, at the moment across the water, whilst they had announced that £10 million to support the establishment of clinics in England, that funding came from within their existing budget. So there haven't been any Barnett consequentials of that coming to Northern Ireland as yet. So as you know, and as we've said today, our budget position is very constrained. So I can't give you really any assurances around where and whether that funding will come from as yet, but we are obviously conscious of the need and are working on what it might cost.
Okay, no, I appreciate that, and thanks for all the answers. Thank you.
Thank you, Paula. So we're going next on our list then. At this point in time, we have Jerry, Orlia and Alan in that order. So I'm going to Jerry. Go ahead, Jerry, please.
Thanks, Chair. Thanks, panel. And no disrespect to the panel at all, but this budget is really unambitious, uninspiring, unimaginative, given the challenges we face with waiting lists and every other aspect of health, given the year people have been through. It really is very disappointing. And even the notes said final settlement remains extremely disappointing. I would concur with that, but I'd like to ask what work has been done or what work was previously done to challenge what has been described by the department as an extremely disappointing final settlement.
Okay, I think it's, we're very disappointed with our settlement. I think the same is true of most Northern Ireland departments, and indeed I think the Finance Minister was disappointed with the settlement that Northern Ireland has received. And I suppose in that context, whilst we have been challenging and we have been articulating the difficulties it will provide for health, I'm not sure that the Finance Minister currently has any more recurrent funding he can give us. I think the level of recurrent funding that was made available at block level made it very difficult. So I suppose I'm the Finance Director for Health. It is my job to advocate for health, but it would be remiss of me not to acknowledge the challenges that my counterparts are experiencing across government at this time. So yes, we continue to make the case. I suppose it's made quite difficult in the time of COVID because, as the chair drew out a little bit in his questions, we're not we don't have a clear vision of what we think the health service should look like post-COVID, because we're still trying to learn the lessons that we've learned from having dealt with COVID, some of which have been very useful in moving transformation on. So the service that we want to build back post-COVID is not necessarily the service we had before COVID. And we need, I suppose, a little bit of space to take a breath, to ensure that we work out what that should look like. And that's why we maybe don't have the answers to hand at the moment, but very, very conscious that that work needs to be done at speed so that we are ready and prepared to make that robust case as we come into the next budgeting period. And we do continue to make the case with the information that we do have available to us as strongly and robustly as we can.
Thanks, Bridget. And I suppose from my end, it's very concerning to hear, thankfully yourself and others say that the budget isn't great, but no sense of a strategy to try and change it, tackle it, or put pressure. I suppose I'll come back to that. And I suppose just to respond to that quickly, I think there is a bit of people may have different ideas, but I think there's a consensus developing that people appreciated what the NHS did for them during the pandemic. They obviously clapped for it. So whilst people may have different specific ideas, most people want to maintain it and strengthen it, is what I'm hearing. But like I said, to move on, just on the issue of pay, just to get a bit of clarity from previous members' questions. So I think it's the 85 million set aside for 2021. Is that presumably the historical addressing of the underpaying that obviously people were out on strike for? Can I get a bit of clarity on that?
Yes, so that 85 million, I think actually covers 1920 and 2021 pay to bring the AFC staff up to pay parity.
Okay, thank you. And just to clarify again, so currently there's no money set aside in this budget for a increase, if you will, post-COVID. I note that trade unions are calling for some cases 15% pay increase. Some unions are calling for a £3,000 increase for their members, and I'm sure we all agree they warrant that and more. But to clarify, there's no money set aside for that or figures similar to that in this budget.
That's correct. At the moment, as I say, the AFC pay is based on the current proposals by the pay review body, and other pay levels are at similar levels to that.
Okay, thanks. Just a couple of quick points there, Chair. And just to say that, so obviously the pay review body is constrained, presumably, by the fact that there's no extra money set aside. So is their offer therefore constrained by that reality?
So I imagine, I don't know for certain, but that it will be the Westminster government that is feeding into whatever pay constraint there is on that review body. We will need to see what their recommendations are. But with the challenging budget we have, if we were to want to go over and above their current recommendations, it would mean that one of the other things that is on this list would either one of the other things that's on the list for health would reduce, or that we would be looking, I suppose, to the executive to reduce spending in another area within, the Northern Ireland budget in order to fund that.
Yep, thank you. Just final question. Elective care, £40 million has been set aside. What's it presumed that would be spent on, Bridget? Thanks.
So I don't have a detailed breakdown of exactly what they would propose.
What I'm trying to really, just to try to cut in, what I'm trying to really ascertain is that money going to be redirected to the NHS services, or is that money that will be going to the quote-unquote independent sector?
So it is planned that will be going to the independent sector, and the main reason for that being that we will still have constrained capacity in the health sector, in the health and social care sector, particularly because staff will have just come out of a surge and they will need some time to rest and recover. So there will be lower capacity in our own areas over 21-22 compared to years where we've been working at full capacity. So yes, that 40 million we expect will be spent in the independent sector.
Thank you.
Okay, Gormaga, Jerry, and going then across to Orlia Flynn, Lanare, Orlia.
Gormaga, Colm, and thanks to the officials for coming today with this briefing. So first of all, I just wanted to ask maybe for Bridget, can the department confirm, or has the department worked out what percentage of this budget has been spent on mental health?
I don't have the percentage of the overall budget to hand. Of the additional allocations, we're looking at around about the £38 million mark. So there's £10 million there that are from the confidence and supply mental health, and another £28 million then from the transformation and rebuild. That doesn't include any response funding then that would be directed towards mental health. So that's, I suppose, the increase on the previous baseline. But we haven't crunched the numbers yet on what that means for the overall percentage.
Okay, thanks, Bridget. And I'm just wondering, when you do that sort of number crunch, could you let me know, or let the committee know, so what share of this budget has been spent on mental health and on, I know Cara raised it earlier, and on CAMS. I know you were saying there's no additional money in this budget for CAMS, but it's just to get that actual figure of what spend is going towards mental health, and first of all, and then the CAMS. That would be great if we could get that. Thank you. Then my second question is around, so you had touched on the multidisciplinary teams and that 22 million, which is basically just continuing on with, you know, the services that you have in place currently. So Ciara, you had mentioned that you know, even within that there is a slight growth. And could you maybe just elaborate on what that slight growth is within the MDTs? And then I know Cara had touched on the 3.5 million, and Bridget, you had mentioned a couple of different projects around Protect Life 2 and the former aid service. Could I get in writing the breakdown of what that 3.5 million is? And also the breakdown of the 2.5 million that's been spent on the mental health task and finish group. I just think it would be good, it would be useful for myself to have that detail around those figures. And then just finally on that then, I didn't hear any mention as yet around the multi-agency triage teams that are operating in Belfast and the South Eastern Trust. And the plan is obviously to have those expanded. It might fall under that Protect Life 2 funding, but it's not referenced anywhere specifically in your briefing paper. And I can see that 0.8 million has been ring-fenced or will be spent on prison healthcare. And can you confirm, is that the custody suites, the mental health custody pilot, the pilot that was done in Musgrave?
Okay, to take the last part first, Orlia, and apologies if I forget some of the rest of it. Yes, the funding for prison healthcare is for Musgrave, and actually potentially to expand that into Antrim, although COVID may delay that expansion. On the MDTs, Ciara, do you have the MDT information to hand?
Yes, I do. Just got it on screen here, 1 second. Orlia, yes, there is a slight growth in MDT. So the growth, there was the amount spent in the last financial year was 18 million, in around 18 million. There's an additional 3.9 million this year, and that's the rollout and implementation of the current services with the practice-based physiotherapists, with the mental health workers and the social workers. But I know that this increase also includes a significant part of that additional investment in additional nursing specialist roles, such as health visit and district nursing. And I do know that there is a particular focus at the moment in mental health support through MDTs, because we're aware of the mental health issues that are arising. So there's a particular focus on putting in mental health specialists there. Is that okay?
Yes, Ciara, that's great. Thanks very much. And see, just on the multi-agency triage team, so is that falling anywhere in this budget?
I'm just looking. It is. Let me have a scroll on through. What was your specific question on that, Orlia?
It was just, is there
mental health triage team
money set aside for the street triage teams? I know that there was talk about, obviously, there's obviously a wish to expand it right across the 5 different trusts. We're probably not at that point looking at this budget, but is the money for Belfast and South Eastern?
Let me have a wee look. I know that there is money for that in this. Let me have a wee look if you want to.
Yes,
it might be. I know earlier there was some of those things you specifically wanted us to come back in writing, so maybe we could pick that up, this bit up as well, if that would be helpful.
Yes, no, that's brilliant, Bridget.
Although I think I'm just finding in my briefing actually that there is about £300,000 set aside for multi-agency triage teams. I don't have the detail of exactly what that's funding, but it's definitely in there.
Okay.
Apologies, we've so many lines in this. Sometimes it's just hard to orientate ourselves around it.
No, don't be worrying, and sorry if I missed it. But as I said, it'll probably come under that briefing anyway, with the breakdown of the 3.5 million and the 2.5 for mental health. If you can give me that in writing. And then just finally, maybe for Prita on the capital. So I can see obviously under some of the committed projects, the Hollywell is there. It's progressing to the stage 1 design stage. It has the 2.5 million allocated towards that. But at a previous briefing, Prita, there was mention somewhere around the doing work to look into a mother and baby perinatal mental health inpatient unit in the South Eastern Health and Social Care Trust. Now, it was at a very early advanced stage where I think you were just sort of, doing a business case around it, and it was only a 7 or 8 bed. It's a small unit, but it was definitely referenced in a previous briefing that we had. And I'm just wondering, is that mother and baby mental health unit contained anywhere within this budget, or has that been pulled?
Okay, so the business case for the 6-bedded regional perinatal mental health mother and baby unit, it's currently being developed basically. I know that currently the services in Northern Ireland are pretty limited around that. The location hasn't been determined, but it could form part of the Northern or South Eastern schemes or be a standalone facility at Belfast. I think CPD are currently estimating the cost of that to be around 4 million. We included it in a 4-year budget gathering exercise DOF in September 20 to start from 23-24. So that's where it is really. It wouldn't be part of this current budget, but it's in our long-term, it's on our long-term sort of radar. And the business case is this work is ongoing on that basically.
No, that's fair enough, Prita, and thank you for that update. And I suppose, I know that Ciara and others have mentioned that you are dealing with all sorts of priorities, which are all as important as the next. But just on that particular, and it would be a small unit because it doesn't impact that many women, thankfully, but nevertheless, it is impacting on women currently, and there is no facility at all on the island of Ireland for a mother and baby to have that inpatient unit if a mother becomes severely mentally ill. So it's just to put that point on record that it might be a longer term priority, but I think it needs to be dealt with in the more immediate term, because currently there's no unit for any woman to go and she's separated from her baby and all the rest. So but I appreciate the update that you've gave me today. So thanks very much again to you all.
Thank you.
Chair, can I just add one point to find the multi-agency triage piece for Orlia? Earlier there is 85,000 growth in that this year. So last year there was 186,000 to it, an additional 85, which takes it up to about 272. So there's a slight growth in it, and the service is continuing.
I appreciate that, Ciara. Thank you.
Thank you. And just Prita, to pick up slightly on that perinatal mental health unit, I presume a unit like that, if it's going to be regional, will take accessibility into account. So I heard reference to Northern, South Eastern and Belfast, and clearly people from Fermanagh, Tyrone, Derry, and indeed, as Orlia has mentioned, the catchment of the entire north, including, if necessary or if beneficial, parts of the 26 counties. But I presume a unit like that, accessibility for patients and their families and visitors and all of that will be a very central figure or factor in the consideration.
Colin, I'm not overly familiar with the process to date, but yes, I know that those considerations are looked at as part of all services, so I would like to think so.
Yeah.
And it's in the early stages of development. Obviously, no location has been determined at this stage.
Yeah. Yeah, and it also became apparent during the neurology recall that because it was a regional service based in Belfast, it put undue and disproportionate pressure on the Belfast Trust. So I think we need to consider that when we're allocating. If we are transforming services, they need to be regionally balanced and they need to meet the needs of everyone. So I think that's critical that we don't just go for kind of the same old, that there's a bit of imagination and a bit of coordination and cooperation right across the region and between here and the south. Okay, thank you for that. So I'm going then to Alan Chambers. Go ahead, Alan, please. Alan, we're not hearing you once again, Alan, I'm afraid. And you're not on mute here on the system, Alan. Okay, I'll move on, Alan. I'm not sure. I'll move on there. So listen, members, we do have maybe a couple of maximum 10 minutes of this briefing if members want to come back in with a point of clarification or another quick question. So I do have one quick question there, but I know that Carol has indicated that she wanted a bit of clarification on one of her questions. So I'll go back to Carol first and then I'll come back. And if members want a very quick question, please indicate again. So go ahead, Carol.
Quick, it's primarily on the budgets and the budget headlines for neurology. So I think you said that there was, or sorry, it says here there's additional money, or you said there was additional money for neurology services. So, I mean, I would anticipate that you would have a narrative for that. So is it to help with the third recall? Is it to bring additional consultants in? What's that for?
And my apologies, Carol, I don't actually have a detailed narrative on that one. It is something I can pick up and come back to you in writing, if that's okay.
Yeah, if you could, Bridget, I'd really appreciate it, because you will be aware that the Minister brought a statement, and it would be completely appropriate that we would get that information as soon as possible, because that statement and the anticipation that there'll be a third recall has caused a lot of stress and anxiety, and we need as much clarification as quickly as possible. Thank you, Chair.
Okay, thank you. So a quick one then from me, Bridget, is the issue of co-production and co-design has come up frequently, and we are very, very keen as a committee to see if we can get that improved and get real meaningful. So in that context, what budget has been set aside for consultations, to conduct consultations in this year's budget?
Okay, I wouldn't have a figure for consultations split out separately, Chair. Any funding for consultation would generally be built into the budget for a particular strategy or a particular area. So I kind of don't have a separate funding line for consultations. I know I have within my briefing in a number of the breakdowns of the additional amounts money for a consultation on, or money to, so I am confident that consultation is being built into those proposals, but I wouldn't have a separate figure for consultation. It would be built into each of those particular funding areas where appropriate and where needed.
Okay, and then in the future, is it possible that would be available to see what's being allocated to the co-production consultation type process?
it will, I suppose it would be an exercise in coordination to pull that out of each of our different policy areas. But certainly, if that's something the committee would like to ask for, it's something we can look at providing.
Okay, thank you. I think it will enable us to just track the progress in terms of improving the process of consultation, co-production, co-design, and all of that. I'm going to go back to Alan here now to see if we can pick up on Alan, and then if I get time, hopefully I'll go back to Pam for an additional question. But I'm going to go back to Alan in the first instance. Go ahead, Alan.
Can you hear me now?
Yes, hear you now, Alan. Thank you.
Thank you. I've finally found the button to press, Mr. Chairman. Thank you.
I'm delighted.
Richard, I know that I'll be quick here, but I know that you can only work with what you have in front of you, and you did use the word challenging quite often during your presentation, but perhaps maybe some of our expectations are more than challenging, that they might actually prove to be impossible. But in terms of the point that the chair raised earlier about the agency staff, can you confirm that really, to reduce that figure, it is really linked with the guarantee of being able to train new staff? And to do that, you do need a much more guaranteed budget than a one-year budget. And the other question, Bridget, is there has been a lot of talk around about top slicing of the departmental budgets to help pay for the Troubles Victims pension. And I think that the figure that has been quoted for the health department is something in the range of £37 million a year for, I think, a period of about 20 years. Should this come to be true, that your department is going to lose £37 million in this incoming year, are you going to be coming back to us with a lot more bad news?
I suppose the short answers to those questions, Alan, are yes and yes. Certainly, as I had said earlier, in terms of the agency workers, it really is the workforce strategy and our ability to train staff that will be a key driver of our ability to reduce agency costs. And as you say, any reduction in our budget will lead to more difficult choices. And I suppose the figure that you're mentioning of 37 million, there's 40 million that we are looking to spend this year on elective care, and that's looking to see around about 160,000 patients. So, if we were to lose 40-ish million pounds, that's the kind of impact that it could have on the health budget.
Thank you, Bridget. Thanks, Chair.
Sorry, Colin, you're on mute.
Yeah, so going very briefly then to Pam Cameron for a final question. Go ahead, Pam, please.
Thanks, Chair. And I appreciate the opportunity to ask another question. I wanted to ask if you could tell us more about the allocation set aside to meet the challenges arising from the protocol in terms of disruption to medicine supply. Has the potential for further disruption when grace periods end been factored into this budget?
Yes, so Pam, we have there's £300 million specifically in our opening allocation for EU exit, which is funding our transition team, and we have been advised that we will receive around about another £350,000, I think, in year under the from Northern Ireland Protocol funding to supplement that. We've also set aside a further £1 million from within our overall budget allocation to put towards this, and that's in anticipation of additional costs of the UK-wide strategy, and also primarily to fund additional storage needs to enable us to increase our local stockpiles as a result of that. I will be and have been talking to DOF about the potential to secure additional funding for EU-specific issues, and we're certainly looking at putting forward a bid in June monitoring, because obviously that £1 million we have at the moment in our budget is £1 million that could perhaps be spent on something else if there is indeed a separate funding pot that we can secure that money from specifically to deal with the Northern Ireland Protocol.
Thank you.
Okay, thank you, Pam, and thank you, members. And I would just like to thank then Bridget, David, Preeta, and Ciara for your attendance here this morning, for your presentation. I think it is something that we're significantly concerned about. Clearly, that there's a very challenging budget situation and a very challenging health situation, and that these are going to require massive efforts in order to deal with mental health problems, the waiting lists, the transformation, and everything that's going on there. I suppose in terms of this morning's session, it strikes me that we do, I think, need as a committee to maybe try to see, can we engage with you in terms of how we might improve the process of us getting a clear line of sight and getting underneath the bonnet of some of the figures that we're being presented with. And I know, and I appreciate what you're saying, you don't want to detail everything, but I don't know if there's a way that for us to follow. There's also that additional problem that the money is allocated by the department, then goes into the HSC and for commissioning, then goes to the trusts, sometimes gets described under different headings or whatever. So it's very hard to follow. And for me, a key concern about that longer term is that it's very hard to track the impact of budget decisions. Are we dealing with health inequalities? Is there enough money going into mental health and that underspend that we know is there in terms of other regions and other areas? So I think there is a piece of work there to see how we can, in the future, improve the ability to scrutinise into the detail of this and the impact of it. But that is work for ongoing work for us all, I think, to try to do that. But I appreciate your attendance today. Any final words, Bridget, from yourself, or are you content with that?
Well, no, Colin, just to say that, anything we can do to improve the clarity of our communication to the committee, we're more than happy to discuss with your clerk or with whoever appropriate to try and do that. I mean, we would obviously much rather put our efforts into producing information that you find useful, so more than happy to engage on that front.
Okay, I appreciate that, and I appreciate your commitment to provide a fair amount of additional information that members have asked for this morning, so I appreciate that and we look forward to receiving that. But for now, thank you all very, very much, and I want to wish you all good luck and take care and stay safe in the time ahead. Gorma agus slán. All the best. Thank you. Okay, members, thank you. So there is a fair bit of information there, I think, that the officials have agreed to send. But would members be content that the clerk drafts a response to the Committee for Finance for inclusion in its report on the budget? Are members content that the clerk go ahead and draft that report? Yeah, I think members are content with that. So that report will be drafted following any response from the department to those issues that we have raised today. So the clerk will await the responses, and then those can be included as part of the report. So members, I'll take a very short break there, just a comfort break maybe for 10 minutes. Could we come back at 11:10 and we'll resume our meeting at 11:10? And could I ask you, clerk, to take us out of broadcasting temporarily?
That's us all for now.
Thank you, clerk. Okay.
Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed.
So we will now resume our meeting this morning, and we're moving on to a briefing that we're having from the Health and Social Care Board in relation to the Health and Social Care Bill that's currently before the committee. So we're receiving today a briefing from the Chair and the Chief Executive Officer of the Health and Social Care Board on this bill. I refer members to your papers at tab 6 of the pack, and I would now like to welcome to our meeting Mr. Leslie Drew, and Leslie is Chairperson of the Health and Social Care Board. Are you able to hear us there, Leslie?
Yes, Chair, I can hear you.
Thank you, Leslie, and we're hearing you also. And we have Miss Sharon Gallagher, and Sharon is the Chief Executive of the Health and Social Care Board. Are you able to hear us okay, Sharon?
Yeah. Morning, Chair, I am indeed.
Okay, well, thank you both, and I'm glad to see both using headsets, and hopefully that will help with the sound. If I can remind all members of our panel and members of committee to remain on mute when you're not speaking, please, as that hopefully will help with the quality of the sound. So I'll go back to you then, Leslie, just in order of what I have on my list here. Can you outline how you're going to brief us this morning, and then we can move into questions and answers from Members.
Yes, Chair, I have a short introduction, just an overview, and then I'll hand over to the Chief Exec for maybe some short comments and then to yourselves for questions.
Okay, thank you. Thank you. Go ahead, Leslie.
Okay, good morning, Chair and members of the Health Committee. Thank you for this opportunity to be here today. As you've already said, I'm accompanied today by my Chief Executive, Mrs. Sharon Gallagher. My name is Les Drew. I was appointed as chairperson of the Health and Social Care Board approximately 13 months ago on the 1st of April 2020. When I was appointed into this role, I was expecting to be focusing on the closure of the Health and Social Care Board and its migration of its team into a new operating model in line with the recommendations of a number of expert panel review reports. Like most people, I did not fully appreciate the impact that COVID-19 was going to have on all of our lives, as well as the health and social care system. 2020 was to become the most challenging year for the Health and Social Care Board in its entire corporate life. I'm immensely proud of how the Health and Social Care Board team responded to the challenges of COVID-19, helping to deliver the Minister's priorities by working with their colleagues in the Department of Health, the Public Health Agency, hospital trusts and primary care sector. I have witnessed firsthand the incredible creativity and innovation of the Health and Social Care Board team, as they have not only responded to COVID-19 challenges, but have demonstrated a renewed sense of purpose and determination as they have embraced the need for further reform of the current health and social care system. For your information, during the past 12 months, as I've already said, I have been personally involved in the appointment of a new Chief Exec and 5 out of 6 members of the senior management team of the Health and Social Care Board. And I believe that these individuals are all totally committed to the new direction of travel that has been proposed for the Health and Social Care Board. The objective of the bill is to give effect to the decision to close the Health and Social Care Board, which was initially proposed by Simon Hamilton in November 2015 and endorsed by 3 separate health ministers. The Health and Social Care Board was established through primary legislation, namely the Health and Social Care Reform Act in 2009. Therefore, new primary legislation is required to effect the closure of the Health and Social Care Board and transfer of responsibilities for management of its functions to the Department of Health. The bill relates solely to the Regional Health and Social Care Board and has no material impact on other health and social care bodies. The purpose of the bill is to dissolve the Health and Social Care Board and transfer responsibility of its functions to the Department of Health. These functions include commissioning of services, performance management of trusts and other providers, and funding allocation. The bill only contains 7 clauses and 3 schedules. I'm confident that the bill contains sufficient safeguards to ensure that the assets and, most importantly, the staff of the Health and Social Care Board are transferred seamlessly and successfully into the Department of Health. The Health and Social Care Board may be closing as a corporate entity, but the Health and Social Care Board team will continue to play an extremely vital role in the planning and the design of a new fit-for-purpose health and social care system for the citizens of Northern Ireland. The bill also contains some necessary amendments, 69 acts or orders dating between 1965 and 2020, and this is mainly just to remove the references to the old Regional Health and Care Board name. I can also confirm for your information that the Health and Social Care Board existing board of non-executive directors fully support the direction of travel and are keeping a careful watch on progress of this important piece of work. During the past year, the Health and Social Care Board of non-executive directors and myself have continued to perform an important scrutiny role around business as usual activities. I can assure you that as part of our responsibilities for the Health and Social Care Board, we are committed to ensuring that this programme of work will successfully meet its conclusion. And to this end, my Chief Exec is a member of the Department of Health Oversight Board, which has been established to oversee this process. In addition to this, a progress report is provided by the Project Director, Martina Moore, as a standing item at our monthly board meetings. This has provided the Health and Social Care Board non-executive directors with the opportunity to scrutinise and ask challenging questions about this complex project. I can assure you that until this responsibility passes to the department, that the current non-executive directors of the Health and Social Care Board will be fully engaged in the migration process, providing scrutiny and challenge and clear guidance, support and advice when necessary. These functions will transfer to the Department of Health, as I've already said, and they will be subject to the Department of Health's own internal scrutiny and governance arrangements. I have led many change initiatives during in a past life in my career with Northern Ireland Electricity Networks. Based on this experience, I can advise the committee that the programme of work to migrate the Health and Social Care Board into the department would appear to be taken forward after having considered all of the obligations of the Health and Social Care Board and also associated risks. The Health and Social Care Board staff and their trade union colleagues are integral to designing how the new arrangements will work. They are key players in the process and are able to bring to the table a wealth of knowledge and expertise about the current systems and all of the arrangements. The passing of the bill will, however, bring to an end the current local commissioning group structure. This is an area that I am particularly interested in. Indeed, I regularly attend the local commissioning group chairs forum, and therefore I've seen first-hand evidence of the commendable work that they have been doing. I'm also conscious, however, that of the limitations that the current system arrangements have placed on their ability to make a real difference. I believe the bill provides us with a real opportunity to change how we plan services. I'm particularly pleased that the local commissioning group members are engaged in the transition process and are indeed represented on the project board. They have committed to playing a vital role in the design of the new way of working and supporting its implementation. They have valuable insight of both what has worked well currently and also what has not worked well and needs to be addressed. The LGC have historically provided a local voice, and that voice must be clearly heard from within whatever new model is put in place. It's clear that the need for change has never been greater. We heard the Minister last week refer to the current dire situation regarding waiting lists. These are not just numbers, but individuals who could so easily be a member of our family, a work colleague or a neighbour. We must all play our part in arriving at a solution, and part of this must be to look at how we plan our services, to remove duplication and empower our local communities to plan and deliver the services that they need for their population. I'm pleased that this work to develop a new planning model is now going forward jointly between the Health and Social Care Board team and the Department of Health colleagues. This partnership approach recognises the need for joint up thinking and as we try to design a new approach. In conclusion, Chair, the closure of the Health and Social Care Board and its migration, or the migration of its team into a new operating model was first announced almost 6 years ago. This has been a long process, particularly for the staff involved, and I think that the passing of the bill would be a significant milestone in enabling a much larger transformation journey to be taken forward. Finally, I believe that during my short tenure that I have been able to build a strong and robust relationship with the new Chief Exec and Senior Management team. I have tried to engage with the Health and Social Care team, Health and Social Care Board team at every level regarding closure through staff engagement. I'm confident that we all share a common vision for the future where the citizens of Northern Ireland will enjoy better health outcomes. Chair, I was just going to hand over to my Chief Executive to make a few comments if that's appropriate.
Thank you. Yeah.
Thank you.
Absolutely. Yeah, absolutely. Thank you, Leslie. And go ahead, Sharon.
Thank you, Chair. I'm going to get confused today, so I'm working to two chairs at the minute, the Chair of the Board and the Chair of the Committee, but I'll keep it brief. Okay. So, as you know, I've been working on the transformation agenda and specifically this area of work since 2015 when the decision to close the board was initially made, Chair. And that decision was reaffirmed by subsequent ministers since that point. In September, I was appointed Chief Executive of the board alongside my Deputy Secretary role in the department. So it's a unique position in that I'm leading the work to close the board on behalf of the department, but also discharging the Chief Executive responsibilities of running the business of the board and managing the transition of the staff and the functions into the department. I suppose really what we're trying to do in essence is shadow run or shadow form what the new model will look like to test it. We've an opportunity, I think, in taking forward the legislation to build a new way of working. I mean, what we know is that there's complexities in the system and there's a level of bureaucracy in the system, and that's what we're trying to work against in the future. We're trying to make sure that the resources are concentrated to where they will have most effect. I guess, as Les said, it's fair to say that the uncertainty over recent years has had a detrimental impact on the confidence and the morale of the workforce in the board. And since my appointment last September, it's something that I have given a lot of focus to. I wanted to provide some clarity to staff and ensure that they are consulted, not just on the future model, but the role that they will play in it. The decision to close the board, as you know, was taken in the context that the current broader commissioning process isn't fit for purpose. And importantly, as Les has said, work is well advanced in developing a new model for commissioning health and social care services moving forward. That blueprint is in the final stages of development and will be considered soon by our Health Minister. And finally, just in line with what Les has said, I look forward to bringing through this legislation. I think it will mark an end to the, I suppose, the lack of certainty about moving forward. It will allow us to bring forward our transformation journey, but more importantly, it will allay the concerns of staff and really provide them certainty for their future. Thank you.
Okay, thank you, Chair and Chief Executive, both for those briefings. And I suppose, and I am struck, Leslie, that you referenced the fact that in your view, there were sufficient safeguards in place for assets and staff, and that is to be welcomed. And I do get a sense that there has been a fair degree of effort put into that, and I think I certainly, and probably the committee more broadly, would welcome that staff are being prioritised in terms of having this transition managed in a way which reduces any anxiety and is as smooth as possible for them. More generally, in relation to the commissioning, I suppose I was struck, as both of you were speaking, I was struck with the analogy of that you wouldn't ever move house without knowing, first of all, what the new house was like, and also that the new house was ready before you move out of your old house. And I'm just struck with the whole issue around the local commissioning groups, and we've heard several references to the work being well advanced in terms of what would replace it. And I'm just wondering, Leslie, are you satisfied personally in your role as chair that there is sufficient safeguards around the protection of local involvement in the new commissioning model, and even, indeed how that can be enhanced, let alone stand still? So are you satisfied that enough work has been done in relation to that in terms of preparation, and that a committee and everyone else can satisfy themselves that the system in place that is designed to be picked up will be available for us to have a look and scrutinise before this is all complete?
Chair, as I said, I would regularly attend the local commissioning chairs forum, and I've been impressed by the level of engagement from them in this process. Clearly, the process is, there's still work ongoing, and the entire commissioning model, may not be ready for the 1st of April, but certainly the framework, the structure is being thought through. I think careful consideration is being given to where things have not worked and where they can be improved. We currently have local commissioning groups who do not have any relationship with trust, really, a close integrated relationship, but we have integrated care partnerships who have a close relationship, and they will also be involved in making decisions regarding the design of the future model. So I'm confident, I'm very confident that everyone, all of the stakeholders involved are being consulted, their views are being taken on board, and I think that will lead to a much better local population-based commissioning model in the future than what we currently have now. The local commissioning groups have done a tremendous job in terms of their expertise and their knowledge, and I think it's excellent that knowledge, I'm certainly encouraged that it's being captured and it's being brought into the process of developing the new model.
And in your experience, how should the new model differ from the current model? Where's the added value?
I think I think that it has to be based on an integrated care system approach, where it's the local population, representatives who are involved in community planning, who are involved in integrated care partnerships, who are at trust level, who are close to their own populations, will be able to identify the needs, the health and well-being needs of those populations, and to design service delivery that is appropriate to meet those needs. So it's bringing the health and care system closer to the actual population, so that it's not and there's not the same inequality or postcode lottery. Giving a voice to local community in terms of health and social care needs.
And can you tell us any more about how that will be done in practice? What will replace the local commissioning groups?
Well, that's being worked through at the moment, and I'm sure if the chief executive would like to come in and add to that. But the local commissioning group chairs and members are being involved in the process, and what that will look like in a number of months' time, that will unfold, and the chief executive might be able to give just a wee bit more detail on that.
Okay, thank you. Yeah. Go ahead, Sharon.
Thanks, Chair. I suppose I would say a couple of things. First of all, the closure of the board, and you'll have heard this before, Chair, is just phase one. In order to change the way we commission services, it's a massive undertaking. It's a very complex system. There are many players involved, and there's a lot of money involved. And the one thing that we want to protect is services. So, reorganising ourselves can't come at the cost of service delivery, either in resource, as in people resource, or in financial resource. So the closure of the board is step one. As at the 1st of April 2022, we will have new networks formed at local level, and that's the work Martina and the team are working through at the minute, what that looks like. And as Les has said, the local commissioning groups and ICPs and others are involved in determining what that looks like. But you'd asked about the biggest change in terms of the end model, the aspirational model, the one that we're going for in terms of a blueprint. And I suppose on paper, it doesn't look that different, because on paper, we have an integrated health and social care model at the minute, so ICPs, LCGs, they all do a really good job. But the feedback that we're getting and what we know is that they don't have enough, they're not empowered sufficiently well. So the new model needs to look at how we empower the networks at local level more. And that means, accountability, that means funding, that means allowing them to determine what's needed at local level. We have a process at the minute that nearly says that on paper, but works against itself. And the learning that Les has talked about it again and again is listening to the voices of those people that have been involved to say, well, here's what's working well, because not everything's wrong. Here's what's working well, and here's the areas that we really need to focus on to make it better.
Yeah, and given that that's all known, and I appreciate your answers on that, Sharon, but also given your and you've yourself said it's a sort of a unique role in that you're chief executive of the board, but also responsible within the department. So just going back to my house analogy, you wouldn't move out of your old house until you had seen the new house and knew it was fit for purpose. Doing this in 2 stages, or at least 2 stages or phases, is a choice that the department has made. So they are putting in front of us a proposal to close the board without showing us a look at what the new arrangements are going to be like. Can you see where that, why would that be a sensible? Why not? Would it not make more sense that you would simultaneously present, here's what we're proposing to replace it by?
I think that's a fair point, Chair. And I think what I would say is we are doing it simultaneously, but the implementation is going to be staged. So in a very short period, you will get a briefing from the team about what that looks like. And I'm more than happy to come back at that time. And as I say, on paper, it won't look that different. This is about a change in terms of accountability, in terms of a cultural piece, in terms of a real investment at local level, and about a more delegated authority with trusts working with primary care, with community care. When we consulted in 2015-16, what we heard back at that point was we agree the board needs to close because it creates a layer of bureaucracy. but actually we're not quite sure. We're not quite sure how this integration will work in practice. You know, trusts are a big entity. Will other players get lost in that? Will all of the finance go to the trust? And that's the things that take more time. They need time to engage with people, to build the trust, and to move us into a different set of circumstances. Because, you know, my view is when I took this work on in 2015 and looked at the legislation, and I've said this before, my first thoughts, well, what's wrong with that? And any model can work on paper, but it's about how people come to the table, the maturity of the relationships, the trust within the relationships. And I think we need to spend some time and effort in developing that.
Okay, and I suppose I do welcome the fact that we are shortly, as I think you said, going to get that briefing on what's going to replace and what the proposed new model is. Can you commit that we will receive that in advance of us completing our consideration of this bill?
I would very much hope so, Chair. Yes, I think is the short answer. It hasn't been to the Minister, but we're more than happy to come back and talk about that pending the Minister's consideration.
Okay, I think committee will be keen to have that. So thank you for that, Sharon, and I will go then to members. So I'm going first of all to Deputy Chair Pam Cameron, then Carol Nichillen, then Orlia Flynn. Those are the members that I have indicated at present. So Pam, go ahead, please.
Thank you, Chair, and thank you to Leslie and Sharon for your attendance and for your evidence here at committee today on this important subject. I wanted to ask you if there are aspects of the current complaints or appeals processes that for service providers that could be addressed or improved under the bill. That's my first question. And I wanted to ask you also if there are lessons from accountability models elsewhere that you believe are relevant when considering the provisions of this bill.
Pam, I'm happy to take those questions, Les, if you're content.
Yes, Sharon, go ahead.
I suppose in terms of the first one, the appeals in terms of service providers, Pam, was that? So at the minute, the structure is the Minister sets the priorities through a commissioning plan direction, and the board and the PHA alongside partners then create a commissioning plan, and the trust then commit to that plan through their trust plans. In terms of appeals on commissioning decisions, I suppose given that the Minister sets the priorities, the board and the PHA work in consultation with stakeholders about how those services can be commissioned. And that is certainly an ongoing engagement and consultation approach. So there's an agenda there. There hasn't been the case, I don't believe, where there has been a need for an appeal process in that. And, you know, if you could maybe give me an example, I could maybe tease that out a little bit more for you, because I'm not sure I've answered your question there.
No, that's fine. That's fine. Thank you.
Okay, thanks, Pam. And in terms of learning from other accountable care systems or integrated care systems, I suppose we have done a lot of research and conversations and considerations of what others are doing. There is no doubt that an integrated approach is the only way forward. We can't have silos. I suppose some of the learning is what I've just referred to with the chair. It's about relationships, not about what it says on a piece of paper. It's about trust. It's about supporting an integrated care structure with accountability, governance and funding. And importantly, it's about being clear about outcomes and understanding what the needs of a local population are. So very clearly, those people that work within a community, that understand that community, know what's best in relation to responding from a health and social care perspective to their needs.
Thanks for that, Sharon. And obviously the chair of the committee has already touched upon the local commissioning groups, and I suppose there is concern around risk of losing that expertise that is there with the abolition of those local commissioning groups. So I'm just wondering, how do we ensure that commissioning of services doesn't create a monopoly for hospital services, as an example?
So the local commissioning groups is a naming convention that sits with the current legislation, and that's why LCGs, will close, or because the legislation is being changed. The work that we are doing is trying to actually enhance the local voice and enhance the local decision making. So the construct that we do it through might be called something different than an LCG or an ICP, but it won't be that far away, Pam. And it'll, in the main be some of the same people will be involved. They're already taking part in terms of determining what that looks like. But at the heart of what we're doing is putting an emphasis on local commissioning more broadly, local understanding of need, local planning of services, and local delivery.
That's great. Thank you.
Thanks.
Thank you, Pam. Thank you, Pam. And can I just ask all members to go on to mute if you're not speaking? We're picking up some background noise there. So I'll go now to Carol Nicullen. Go ahead, Carol.
Thank you, Chair. Can you hear me okay?
Yeah.
Okay. So thank you, Sharon and Leslie, for the presentation. Some of the questions I have are in relation to, so you've said in response to Pam's question that some of the descriptions might change, but essentially it's the same function. So for example, the local commissioning groups and the integrated care partnerships. But I just want to go back to Colum's point. I think we need more definition at this stage, because while we all supported the position in terms of Health and Social Care Board, I still think there's a lot of clarity that's needed. So, for example, in relation to trades unions and staff side representatives, what role do they have in this process at the minute?
Well, I pick up on the first one, Chair. Just I think I said in my introduction that obviously the staff and trade union representatives from all of the various unions have been involved in the process, and that gives me some confidence in terms of the safeguards around the bill, that they have been involved and are represented on the project board. Sharon, would you like to add that?
Thanks, Les. Carol, I suppose I've mentioned that I've been involved in this work since 2015. In 2018, I set up the staff side forum with trade unions, and that includes NIPSA, Unite, RCN, BMA, and Unison. And that forum meets every 2 months, still runs, and it meets every 2 months. I think you had a previous briefing in terms of the structure of the programme board and the projects, and trade union representatives are embedded in that process as well. So we have put a very strong emphasis on engagement with staff representatives. But I would also say that since taking up post as Chief Executive, I have spent a lot of time and energy engaging with the staff and the board itself about the closure. I have met with every single member of staff since I started in Zoom sessions to discuss, what they do now and try and get an understanding of their future. I've also developed a new broader people strategy. It was just launched this week, called Ambition. And what that does is seeks to build the capacity and capability and try to build the morale again in from the staff and the board, with a real focus on the future rather than the past. So the decision has been made to close the board. We're moving forward on that. And the whole focus for me is supporting staff into that future. So I'm very committed to engaging with the people, because, I keep saying you can put any structure on paper, but if you don't bring the people with you, then, you're wasting your time. So yeah, it's an absolute priority for me and the team and the board within the Health and Social Care Board.
So I appreciate that, Sharon. And Leslie, you said in relation, you're right. I mean, it is a small enough bill. And in terms of some of particularly the question I have is in relation to clause 4 of the bill, when we're looking at transitional arrangements and provisions, which are necessary to mitigate any potential risks arising from the closure of the Health and Social Care Board. So primarily I'm thinking of, so what do you feel are the current risks? And for example, some of these functions will go straight to the department and then to the trust. So for, particular health scandals around hyponatremia neurology, and with another public inquiry coming into urology, what other risks do you anticipate that you need to mitigate against as part of this bill being brought forward? Thank you.
You're just come off mute, please, Les.
Sorry, Chair. Sorry, all of the functions will responsibility for management coordination of them will pass to the Department of Health. If that, to reissue on that. So the Department of Health will be responsible for all of the risk management around that, and will be part of their internal governance and control to ensure that that is properly managed. In terms of other risks, they're obviously in the current COVID-19 world that we're all experiencing, that in itself could be a huge distraction from day-to-day business as usual services. But I believe that each of the trusts have their own board, who also have a role in terms of governance and accountability, and they will be carefully watching the delivery of services from within the individual hospital trusts and also by the other service providers. So, I believe that there is sufficient governance and accountability built into the current system and what is being planned, and that gives me certain confidence, a high level of confidence in terms of being able to respond to any risks that may occur.
And Chair, I'm assuming then, so who's the chair of the Oversight Project Board at the minute?
The chair of the Oversight Project Board, it's Martina Moore, isn't it, Sharon?
Sorry, the Oversight Board, Carol, is
permanent secretary. The project director is Martina Moore, but oversight, the total chair is permanent secretary.
But there's no staff side representatives on that board, are there?
No, that's the chief executives, primarily of the organisations affected. Carol, if I might just add a couple of points in relation to the risks. So you're right, the bill sets out for risks, and that's primarily associated with the transfer of the staff, the assets and the liabilities. In terms of the risks more broadly, and there are many, as you know, in health and social care, and you've named just some of them. I suppose what I would say in terms of my experience over the last number of months when I have held both roles is that it has already reduced bureaucracy and handoffs. And because I sit in the top management group, because I sit on the Rebuild Management Board, and because I work within the departmental structure to the Minister, there's a much closer interface between what the work of the board, between what the board does, how quickly they are engaged, and how quickly they respond to that. So there's not the handoffs that there would have been previously, and you will know that many of our learning in terms of some of these things has been there's been too many organisations involved in that. So I'm already starting to see, and I hope the broader system is starting to see, how that the effect of bringing the board into more direct responsibility of the department is really making a change in terms of the way we do business.
Could I just add to that? I think what Sharon has said is very true. I think there's now a greater line of sight between the department and will be between the department and the trusts at the moment, with the Health and Social Care Board as it were in the middle. It creates a certain level of bureaucracy that obviously, if that is removed, then the department can deal directly with trusts, which will speed up any processes that are involved in investigations, etc.
Okay, thank you. Carol, yeah? Is that you, Carol? Is that you complete? Yeah, thank you, Carol. Okay, and I'm going then to Orlia Flynn. Go ahead, Orlia, please.
Thank you, Chair. Thanks, Sharon and Leslie. I suppose my second question was answered there in response to Carol. So it was really just trying to define, when we're talking about this whole process and this new structure, streamlining that process. the commissioning of services. I think both of you has touched on it there, just trying to cut out some of the bureaucracy, and as you were saying there, Leslie, about the department and the trusts having that sort of, closer connection, and, things being, done a bit quicker and whatever, which all sounds really positive. But maybe if I could just bring it back to, Pam had touched on it in her question earlier, just around the appeals process. So we had a bit of a discussion around this a couple of weeks back when we had a briefing from the department and the bills team, and the issue around the appeals process had come up. So as we know, it's contained within the bill that there is that mechanism for an appeals process for the primary medical providers in relation to their contracts and stuff. And I had asked the question if there could be scope within the bill then to look at an appeals process in terms of the commissioning of services, and how that could be challenged or questioned if necessary. Now, the response the other week was that they weren't actually sure if there was an appeals process around commissioning that was already in place in the board, so it was a bit difficult to sort of continue on the conversation around how it would look at that structure or setup in the revised structure that we'll be working from. So can you just confirm, is there a mechanism in place at the moment for that process?
Sorry, go ahead, Sharon.
Sorry.
Go ahead, Sharon.
I think, I suppose there is no appeals process, is suppose the short answer. In terms of the commissioning process, and I would need to understand better, what you mean by appeals, because when the minister sets the priorities and issues those through the commissioning plan direction, then there's a process in place that takes all of the stakeholders involved in order to develop the response to that. So that's basically the commissioning plan. And in that commissioning plan, then there's sign-offs by the boards. So the board of the PHA and the board of the Health and Social Care Board are all involved in that. That makes sure that it is in line with the ministerial priorities and it is in keeping with our commissioning processes, but also within the budget that has been allocated. So there is nothing in that commissioning plan that can't be aligned back up to the minister's priorities or be affordable within that.
Okay, no, that's fair enough, and I know because you mentioned that earlier, Sharon, that there mightn't be that need for an appeals process in terms of commissioning, and the point that you made there around, I suppose the approach it's taken at the minute, where for talk's sake, if certain stakeholders had an issue, and this has come up in the past, I've certainly dealt with different groups on different issues when a commissioning decision has been made. And not everyone has been content or happy with that approach. So I suppose
I think it's a fair point, because in actual fact there are many occasions when there is a lot of people not content, and it's not maybe about the commissioning because the service is commissioned. It's about the amount of funding that we can apply to that commissioning, and that's a challenging one, because I know you've had the briefing from colleagues in the department just before now. There's simply not enough money to go around, so there's that conflict always between the commissioning of the service itself and how much you can fund to bring forward, the services in a meaningful way that meets demand. And I think, we would all say that in most areas, there's just not enough money to meet demand at the minute.
Yep, and maybe just to pick up on that as well, Sharon, so in terms of the stakeholders that are involved in the commissioning plans and decisions that are made, so how will that change from the arrangements that's in place now? And where the stakeholders come in this current structure, how will that change in the new structure? So then that will hopefully determine the need for an process or not, if everyone's content that they're having their sort of input and their voice heard. Is there a big difference from the structure at the moment and the new one in terms of the stakeholders and their input?
So I suppose the new model, and we talked about this earlier, is actually aimed at giving more accountability and the financial resources at local level so that they can have the conversation, the local groups can have the conversation, they can understand the local need, they can decide on the services that needed, and they can make the investment on those services and hold to account. So it's the same collaborative effect. There may still not be enough money, so there might still be a little bit of conflict. I'm not suggesting for 1 second that we move into this new arena and everybody's going to be content, because there are still, huge challenges facing us all in health and social care. But the key point is that the groups will have the wherewithal that sometimes isn't missing now because of our structure and our accountabilities in this.
Okay, and then maybe just finally, Sharon, thanks for that. So you had mentioned that the chair of the oversight board then is the permanent secretary. So in terms of the Minister for Health, what input or role does he play on that board? Is it then just the responsibility of the permanent secretary to communicate with the minister, or can he play an active role in this new structure?
So the role of the Oversight Board is to basically oversee the closure of the Health and Social Care Board. So it would act in a normal way with the Permanent Secretary, chairing the meetings, and then any decisions falling from that will be a ministerial decision. And in the main, up until now, we've dealt with the process of closing the board, so dealing with the bill, understanding the implications and responding to that. But ultimately, all decisions are made by the Minister.
Okay, that's great, Sharon.
Yeah. Okay, just Orla, just a couple of points for myself, and thanks, Sharon, for your responses. But for me, I think the words delegation and empowerment have come up a number of times, and for me, that's extremely important. That whatever model is put in place, that there is clear delegation and empowerment, and local populations are given responsibility for finance and resources in terms of providing the health and social care needs of that local population.
That's great, Leslie. Thanks.
Thank you, Chair. Thanks, Orla.
Okay, thank you. So I'm not seeing any other indications at the minute there, but if members want to come in for a very quick last point or indicate that's fine. I'll just touch back on them before we go. I suppose just on reflecting on this session and on the previous sessions we've heard, there are a lot of the right things being said, and I think the committee fully support the direction of travel that you're setting out there. The problem here is there's a lack of detail and a lack of clarity. And while we absolutely, I think, want to see the removal of unnecessary bureaucracy and the system working as well as possible, we don't want to lose involvement. We don't want to lose local input and inclusion in the system. We don't want to lose accountability, and we don't want to lose that improvement. So I think it is to me unfortunate that it has been done in a staged way, and I welcome that commitment that you've given us there, Sharon. I think that's important that we do see, given that the work is so well advanced, that we do see the actual detail, because that's where we can look at the granular detail of it and reassure ourselves and everyone that the replacement system is there and is robust and is ready to go and does not only meet the needs but improves that local involvement, that co-production and the accountability process that we're all, I do think we're all on the same page in terms of that's where we're trying to get to. But in relation to the timing, we need to see that coming forward. So I don't see any other indication from members there, Liz or Sharon. I want to thank you for your attendance here today. I think that's been useful, and I'm sure that we will be continuing our scrutiny of this process and our consideration. But I want to thank you for your contribution to that. So thank you and goodbye. We will hopefully see you again.
Thanks very much. Thanks very much, Chair.
Thank you, Chair. Thank you, Sharon.
Okay, members. So, I think there is a kind of that concern there that there's not enough clarity. Yeah, someone looking in there, is there? I'm hearing some background noise, so okay, I'll go ahead. Okay, I'm hearing quite a bit of background noise there at this point in time. Okay, members, if there's nothing further, then we obviously will be continuing our scrutiny of this bill, and I think it's important that we do see what is replacing or what's proposed to replace it, and how that will improve the situation going forward. So, thank you, members. I'm going to move on to the next item on our agenda. Can I ask all members to ensure that you're on mute before we move on? Can I just check, Clerk, have the officials left the line from that last session?
Yes, Chair, they've left. There seems to be a wee bit of feedback from somewhere, but I'm not too sure where it's from.
Yeah. Okay, and it's still there, but it's reduced a little. So, Alan, can I just check if you can go on mute there? You're the only name that I can see that's not got a mute button beside you. And Jerry, also, Jerry Carroll, can you check that you're on mute? Okay, I think that has improved the situation there. I think that has improved there with that. Okay, members, so I'm going to move on then to the next item on our agenda, which are two SRs. Next two items are SRs relating to coronavirus restrictions. Can I remind members that we received a briefing on these SRs at last week's meeting, but agreed that we would defer our consideration pending the report of the Examiner of Statutory Rules coming to us. And just to let members know, both of these SRs are subject to confirmatory resolution. So the first one then is SR 2021/93, and I refer members there to tab 7 of your pack. This SR is a consolidation of the coronavirus restrictions legislation. The Examiner of Statutory Rules has asked the Department to make amendments to this SR to provide clarifications around the closure of listed business or relevant retail businesses. In addition, the Examiner has requested that the Department provides a link to the guidance on funerals in the regulations to improve accessibility. The Department has confirmed that it will make those amendments at the earliest opportunity. So, have members any further issues they wish to raise in connection with this statutory rule?
Chair.
Paula? Yeah.
Thank you, Chair. I'm not sure, are there any officials on the line or no?
We don't have officials on the line because we received the briefing on this last week. Okay. Is that correct, Clerk?
Sorry, Chair, I'm just checking that. If you give me a wee second.
Yep, okay.
Chair, just while the clerk is looking at that, it's really just around the enforcement notices and the premise improvement notices that seem to have been allocated to some of the businesses in Belfast City Centre. And there's been some quite high profile commentary around, for example, the Mourne Seafood Bar and the Sunflower Bar, and I was with AMPM, who also spoken out publicly in the press around some restrictions being placed on their ability to operate from tomorrow. So it's really just if there was departmental officials there for us as elected reps, especially those of us who represent urban areas that are going to be most affected by this, whether we can get a bit of clarity as to what actually has happened in the last week or so compared to what happened last summer whenever they were operating under the same conditions. So I'm not sure whether we can get clarity today.
Okay, I'll just check back with the clerk. Clerk, have you anything to add to this?
Sorry, Chair, we're just confirming there is an official on. They're down as withheld, but we're just trying to confirm who that is at the minute.
Okay, well, maybe I propose we'll move on to the next SR, and we have then a third SR in terms of mental health, and we'll come back to this one and see can we get an official on the line to address that, given that these situations have arisen since last week, I think is what you're saying, Paula, or have emerged. So I'll go on to the next SR, and we'll let the clerk see if he can get an official onto the line. So I'll move on then to item 8, which is SR 2021/97. And I refer members to papers on this SR at tab 8 of your pack. These SRs provide for some easements of the restrictions, permits click and collect services, removes restrictions on movements, allows 10 people to meet outdoors at a private dwelling, and allows for the reopening of certain business. And having read that over, I think that is likely to overlap maybe slightly with the question. So in that case, what I think I should do then is move on again and come back to both of those. We have a third SR in relation to the mental health order, which I think we'll move to now, and then we'll come back to consideration of both of those SRs following that. So moving on to item 9, which is SR 2021/101. The Mental Health 1986 Order, Amendment Number 2, Order NI 2021. I refer members to the papers at tab 9 of your pack, and in particular to the Clerk's memo at tab 9.1. Members will recall that the Department made an SR earlier this year, which extended the period of time which must elapse for a second opinion to be required for the continued administration of medicine to patients detained under the Mental Health Order from 3 months to 6 months. The SR before the committee today changes the period required for a second opinion back to 3 months. So this is an issue that the committee has pushed the department on, and I do think we welcome that the regulation and the move to go back to the 3-month limit. The department advises in the explanatory memorandum accompanying the rule that it has consulted with the Health and Social Care Trusts, the Health and Social Care Board, PHA, professional bodies and others on the change, and that there was broad support for the change. This SR is subject to negative resolution. The Examiner of Statutory Rules has no issues to raise in relation to this SR. So any members' comments in relation to that? Or Leah? Yeah. Go ahead, Leah.
Sorry. Yeah, sure. It's obviously just a welcome that provision is backing out of the 3-month period, so patients don't need to wait to the 6 months. And as you said, I think the committee did do good work on this. Just tracking the department's progress and movements on how many times it was required that people did have to wait the 6 months. But it was just to make the point, if you remember, it was last week or the week before when we were discussing this, and we had agreed that we would write to the minister just around the concerns that there is. There's that extremely small, limited number of staff that can give these second opinions, and the department in their latest update to us, it says that the minister was working with or speaking with RQIA to try and look at enhancing that provision. So it's just to make that point again that we'll have that letter in, and hopefully there'll be a bit more progress on this issue in the time ahead. But just glad to see that that it's back to the 3-month period for people getting their second opinion.
Thank you, Arleah. And Jerry, were you looking in there? No, okay. Thank you. Okay, thank you for that. I don't see any other members indicating their presence, so I'm going to move to our formal consideration of this statutory rule. So can I ask members to agree formally that the Committee for Health has considered SR 2021/10, the Mental Health 1986 Order, Amendment Number 2 Order, NI 2021, and has no objection to the rule? Are we agreed? Agreed. Okay. Thank you, members. And I'm just going to check back with the clerk if we have an official on the line. If not, we will move on to other items of business and return to this to provide additional time. But I just want to check with the clerk if he's made any progress in relation to officials.
Yes, Chair. We did ask officials to be on standby. I do see that we have a withheld number on, but I'm not sure. I know Liz and Marianne had been due to be on standby. So
I'm not sure if you can hear us, but we are here.
Yes, thank you. We are hearing you there, Liz. So listen, Liz. Yeah, thank you for joining us. I know we did have a briefing on this last week, but members have raised, and Paula Bradshaw particularly, raised a point that has arose since last week in relation to some difficulties businesses are experiencing. So I don't see you there, but I am hearing you, and I'll go across to Paula and ask Paula to go ahead with her question.
Thank you, Chair, and thanks to the official. I didn't see the name there, but it's really just in terms of the public discussion at the minute regarding the social media posts from the likes of Sunflower Bar and More Seafood for example, who are saying that they have received notices from, I think it must be council officials, enforcement officers, to say that they cannot open tomorrow, even though they haven't changed the setup from last summer. And I'm just wondering, I had a quick look there, but so it could be in the wrong, but I'm not seeing any change really in terms of the regulations that have come before us, apart from switching on and switching off. So is this an issue with how council are implementing the regulations? Is it to do with the smoking, outdoor smoking spaces regulations? Or what exactly is the problem there? Because there are businesses who have fresh produce that's arriving, staff and table bookings, etc., that they will probably have to cancel today if they can't get some sort of resolution and understanding of what went wrong. Hope that makes sense. Thank you.
Thank you. Yeah, we are aware of the discussion about this. So I think it's come to the fore because of the changes around outdoor hospitality settings. But the link to the definition of indoor and outdoor, which is to the smoke-free regulations, that came in 2007. It has always been there, dating back to the number 2 regulations in July 2020. So that has been retained, and the opening of outdoor hospitality has been linked in the same way as it was last year to the definitions within the smoke-free legislation. So I think the other dimension of this is around enforcement and the way that councils are dealing with that, and that is not something I could comment on.
Okay, thank you. So just to confirm, then you haven't updated the guidance from last summer. This is more an interpretation of how councils are actually carrying out their enforcement role in relation to outdoor spaces?
That's correct. I think the definition is clear in the regulations.
Okay, and just finally then, is there any movement, maybe even today, from the executive to intervene and quickly update those regulations or the guidance in advance of tomorrow? I know it's very, very short time, but obviously the businesses are under immense pressure. So is the department looking to maybe intervene? Is my question. Thank you.
Well, from our perspective, it's clear in the law, so I can't comment on what other discussions might be going on around that. But in terms of the regulations, there's no intention to change the regulations.
Okay, thank you very much.
Sure. Okay. Thank you. Well, yes, go ahead, Carol. I have just to let members know, I have indications from Carol, from Jerry Carroll, and from Pam. So go ahead, Carol.
So thank you. So in following up from what Paula has asked, Liz, what I would like to know is that given the fact that there seems to be a disparity across council areas, because what you've said is the guidelines have not changed from last year, the same structures, the same conditions are being used this year as they were last year. So I would like for the Minister to ask TEO what difference there is this year from what there was last year. I don't think it's good enough, in my opinion, to say that, there's nothing else we can do, because I know that staff have been taken off furlough. I know that other staff have been brought in. People have made bookings, albeit provisionally, and this is a complete mess. And what should be particularly a really good news story for Belfast, and I could only talk about my own constituency, is now turned out to be a complete dog's dinner. So, and that's notwithstanding the stress and the financial hardship that it's brought to those businesses that are involved. It's also a big embarrassment for the council, and it's a huge embarrassment and a huge disappointment for the chamber. So if you could, Liz, bring it back to the Minister, and Chair, if we could ask at the end to write urgently to TEO and the Minister to see if we can get this rectified before tomorrow, please.
Okay, thank you, Carol. Jerry Carroll, Lanneray, Jerry.
Yeah, just following on from that and two other questions. And it seems to be from looking at the sunflowers commentary and speaking to people there that they're being told because they have four walls that they cannot open. But even if they had knocked down some of the walls, then they still couldn't open. And that just seems bizarre to me in terms of the current guidelines. And my understanding is obviously you can be at the back of somebody's property outdoors safely if they have four walls. So I suppose what's the difference between under the regulations outdoor bars or other premises and people's homes? The other two questions is I was just looking through again the part 3 of the first SR. It says a person may only organise, operate or participate in an indoor gathering of more than one household if it consists of no more than 6 persons and no more than 2 households. So I don't think that was discussed last week from my recollection, but can we get some clarity on what those events are, what they're able to be? And then finally, I know some members asked it last week, but just for clarity's purposes, in terms of travel, the stay-at-home message has obviously been lifted, and there was a 10-mile, I think it was a guidance, it wasn't a legislation, in terms of people not travelling. Has that been removed, or what is the current restriction on people travelling? Because obviously there's been a change to caravans and other operators, and people can travel to those. So what is the current restrictions around travel, if any? Thanks.
Thank you, Jerry. Go ahead, Liz, please.
Thank you. I'll come back to the first one last because I actually didn't really follow the question, so I'd like some clarity on that. But if I just start with the 6 from 2 in private gardens, Jerry, is that what you were asking about?
Yeah.
6 from 2, it says indoors in the regulations.
6 from 2 indoors.
I can read it to you if it's helpful. A person may only organise, operate or participate in an indoor gathering of more than one household if it consists of no more than 6 persons and no more than 2 households.
Thanks. Yeah, no, now I'm with you. That provision applies to general gatherings. It's not within or outside and in private dwellings. So I think maybe that's the clarification you were looking for.
I'm aware of the outdoor 2 household restriction, but it does say indoor in the preceding sentence. But if you're telling me that it's the general regulation for outdoors, then I take your word for it.
Okay.
Yeah, that's the issue. It's for indoors, but not in private dwellings. It does say that somewhere in the regulations, so you'll be able to find that cross-reference. There obviously are exceptions that are made in the regulations around workplaces and education and so forth.
Okay.
Okay, thank you. Going then to Pam Cameron, and I will then go to Jonathan.
Yeah, sorry, there's 2 other questions just to answer, sorry.
All right, okay. Yes, I was just going to come to the travel one. So as we discussed last week, the restriction on people's movements that required them to stay at home or the place in which they live, unless they had a reasonable excuse, that was lifted from the 12th of April. So there was no legal barrier to people moving about within Northern Ireland or, in fact, leaving Northern Ireland. So the restrictions were around incoming travellers from places outside the common travel area. Does that answer your question, Jerry?
Thank you.
Yeah. So could you just go back to your first question?
Yeah.
I wasn't quite clear what you were asking there.
In relation to the bars, and one of the bars that's been mentioned by others, the Sunflower Bar, are being told that the reason why they can't open is because they have 4 walls, and that seems perplexing. They have an outdoor facility as the other bars and other restaurants. So is there a discrepancy in the law to say that some walls are safer than others. Not to be facetious, but there seems to be something really amiss, some gaps in the legislation, and they're sort of puzzled, as are others, and so am I.
Thanks, Jerry. That's helpful. That does clarify the question, and Marion's going to answer that for you.
Hi, so Jerry, in terms of smoke-free legislation, for it to be outdoors and allow smoking, it needs to be 50% open under that legislation, and because under these regulations, enclosed or substantially enclosed is coming under them regulations, it means that any of these outdoor areas still have to be 50% open. Does that make sense? Does that?
Just sorry for my own ignorance, could you explain what 50% open would entail in an outdoor facility?
Well, like you saying, 4 walls there, so that would have to still be 50% open. You know, say two openings at each side, and maybe a roof opening. That would be up to, I'd say, environmental health would determine that. Going by the look of it. But that's where that comes in terms of the 4 walls, where they would be determining if it's 50% open under that legislation.
Okay.
Okay, thank you. Thank you, Jerry. And going into Pam Cameron. Go ahead, Pam, please.
Thanks, Chair, and thanks to, I think it's Liz, isn't it, and to Marion there for some of the clarity coming through, in particular to the issue around those staff who have now come across serious problems and feel that they're now not going to be able to open tomorrow. I think it is very worrying, and I share Carol's concern around the staffing issue and those that have maybe come off furlough and will not be able to go back on because they've actually changed jobs. I think it is a real issue, and I would back that call to write to the Executive Office to try and get clarity on some kind of resolution if that's possible. But just for absolute clarity, can you tell us, are you saying that the problem is actually enforcement in terms of the smoke-free legislation, and that actually what has happened, I'm taking from what you've said that what has actually happened is that the establishments who opened previously in COVID actually should not have been allowed to open the last time, and that's why now they're encountering these problems?
I guess what I'm saying from the point of view of the regulations, the position is consistent with the way it was last year. In terms of individual enforcement decisions and operational decisions, I can't comment on those, but I do know, as you've all articulated, that a problem has emerged this week, and it is being discussed for sure, because it's causing significant disturbance. So your point is noted on that. But in terms of the regulations, that there's consistency with the situation as it was last year.
Okay, thank you for that, Liz. I suppose just a final comment on that. Obviously, communication has become a real issue here between departments and enforcement from councils and environmental health or whatever. So I think clarity needs to be sought on this very, very urgently to address the problem, if at all possible.
Okay, thank you, Pam. And going then finally on this to Jonathan Buckley. Jonathan, go ahead.
Thank you, Chair, and I would concur absolutely with previous members in relation to their comments surrounding the differential between councils, which does cause for a lot of confusion, not only to businesses, but indeed also to those that are using these facilities. Liz, are we in a place now to maybe give a wee bit more clarity as around the wording of stay local? I know I quizzed you about this last week. You said there was conversations ongoing. Could you maybe give me an update?
My update is that it is being discussed in the executive today. That's the update I have for you.
Liz, and I'm not here to shoot you as a messenger, definitely not. But that is the exact question, or that's the exact answer I was giving last week. You know, this is moving on. Stay local needs to be clarified. People need to know exactly what they can and cannot do. I welcome the fact it's moving in the right direction, but we need to be clear on the messaging.
Well, I don't disagree with you on that, and that is why it is being tabled for discussion today.
Okay, so you don't disagree with me on it. You've obviously fed in exactly what we said at the last week's committee meeting. What was the response to those in which you fed it into as to what the message meant?
Look, this is something that I am leading this discussion on for all of the departments and the executives. So I'm not able to answer that directly to you today, but I can assure you that it is under discussion at the moment, and there will be clarity on it.
Okay, Liz, you've told me you're leading on it, so therefore you should be able to answer my question. When you reported back to the centre as to what the stay local message meant, you said that yes, this was a concern last week, that you were getting clarity on it. We're now a week on later. You would have known that I was going to come back to ask the question. What was the response?
The response is in the form of a paper that is being discussed today by the executive. That is what I can say.
Okay, I'll not continue on that line of questioning, but I have to say I'm disappointed. You know, it's a clear question, it's a genuine question. You know, we're moving through these regulations, parts of our economy are reopening, and the key message being put out by the executive and being reinforced by its officials at the committee, and we can't even get a definition. I don't think that's good form. Thank you, Chair.
Okay, thank you, Jonathan. And I suppose that also raises the question. That also raises the question, Liz, in terms of messaging and measures and all of that. We have been, I suppose, conscious that living here on a relatively small island, a single epidemiological unit, has there been any consideration, if we're looking at the message, has there been any consideration, and indeed the measures that the messaging relates to, has there been any consideration given to how we can harmonise that around, say, potentially using county boundaries, using provincial boundaries, using local government? Is that a part of the consideration here as to how we better coordinate our efforts with the South and try to iron out and reduce the potential for varying levels of transmission continuing to create problems for all of us? Is that part of the consideration in the messaging?
Well, it's obviously a very important point, and it is the subject of many considerations and discussions, ranging from chief medical officers right down to the public health officials on the ground on either side of the border. I think it's what you've opened up there is so much bigger than these regulations and the purpose of our attendance today. So if you would like more information about that, I'm sure we can arrange a session for this to be discussed. But I think this discussion today is about 2 amendments to the restrictions regulations. So I'm happy to take any further questions on those.
Okay, and I do appreciate that this is a bigger conversation. However, I suppose what I would say is, in general, is that we all understand that mistakes can be made, and this all came very, very as an unprecedented situation. But as we go forward, I think we want to see continuous improvement, and that mistakes are not repeated, and that as we build in improvements, we take that more holistic approach into consideration. So I'm going to go, Jonathan, I'm going to go to Ciara Hunter. I'm going to go to Ciara Hunter first.
Thank you,
Go ahead, Ciara.
Thank you, Chair. And I'm just in agreement with other members and their previous comments. I think that the point that Jonathan has raised around stay local, it's entirely vague. It's open to interpretation. And certainly in the more kind of touristy areas, such as the North Coast or Newry, Morning Down, we do see an influx of people. So I think a strength around the stay local message would be helpful, and clarification on that is much needed. This may have been mentioned by other members of the committee, but can I just ask again what conversations you're having with as officials with local councils to ensure it's equal right across the board? Because I do note with hospitality in my own constituency, I think there's a lot of anger, a lot of frustration and a lot of resentment. It seems very strange that this time last year they were allowed to open in the same circumstances, and yet this year it seems a lot more strict. And I know the hospitality have been very patient. They've followed every rule in the book within guidance, and I think they've invested a lot of time, money into ensuring that the arrangements outdoors are suitable. And then now we're hearing last minute that there's enforcement and issues. So just some feedback on you and what conversations you've had with council, I would find very helpful. Thank you.
There have been, I think I've described before, we discuss things with them every week in the cross-departmental meetings that are chaired by the Executive Office. The councils are represented there as a PSNI. There were specific discussions about this held on the 21st of April. I wasn't personally involved in that. You can imagine that this is a very broad piece of work. There's a range of people involved. The meetings involved our department, communities, economy, tourism NI, councils, PSNI to discuss this issue, and absolutely those discussions will be resumed and almost certainly are. I might not just know exactly the detail of what's going on there today to try to address the issues that have come up.
Okay, thank you. I just think as we move forward and our economy does open up again, I just think it's important the department is very clear with the relevant kind of sectors on what will be expected, what rules they need to abide by, and then also just be mindful. I know this week I've had a number of constituents so confused as the regulations and guidance changes, what it means for them, what they can and cannot do. So I just think it's important that we keep communication clear from the department as the guidance changes. Thank you.
Thank you, Cara. And a very brief point then, Jonathan, please.
It's just developing on your concept there, which I think is important about, being clear about all of this. And I think Cara has nailed it on too. Can I just for clarity ask, so when we put these questions to you, Liz, what do you then do with them? Who do you, as taking the lead on this, who do you feed them to? And then how do those conversations make their way to executive ministers for their opinion?
Well, I've explained to you already that we have regular cross-departmental catch-ups on this, and the issues raised by you obviously inform those discussions. And as I've explained to you, they are appearing today in an executive paper that, in fact, was tabled before, and those meetings didn't happen. But it has been on the agenda. The question that you raised, particularly about what stay local means, and these issues are actively discussed amongst the myriad of other things that myself and other officials who are mired in this are talking about on a regular basis. Also, as you have followed up some of these in writing, we are preparing a response to your letter.
Okay, thank you, Chair.
Okay, thank you. And thank you, Liz and Marion. I don't see any other indications. Thank you for coming on there to address those questions. And clearly there is a need, I suppose, for everyone involved here in drawing up these regulations to ensure that they're being implemented fairly and in a consistent way right across the areas, and supporting business to abide by the regulations, but also that the regulations make sense in terms of consistency. So thank you for that, and we'll continue on with our consideration, but I think that's okay for now from yourselves. Thank you. So members, there's been a proposal there that we ask that we write urgently to TEO for clarity around the situation that has arose. Are members content that we do that? Yeah, okay. Thank you, members. So I'm going to move on then to the formal consideration of each of them in turn. So item 7 there is SR 2021/93. That SR is the consolidation of coronavirus restrictions legislation. The Examiner of Statutory Rules, I'll just go over this for members' information again. The Examiner of Statutory Rules has asked the Department to make amendments to this SR to provide clarifications around the closure of listed business or relevant retail businesses. In addition, the Examiner has requested that the Department provides a link to the guidance on funerals in the regulations to improve accessibility. The Department has confirmed that it will make these amendments at the earliest opportunity. So members have raised further significant issues in relation to the statutory rule, and we have agreed that we will write urgently to the TEO in relation to that. If there aren't any further issues, then can I ask members to agree, and I don't see any further indications, can I ask members to agree formally that the Committee for Health has considered the Health Protection Coronavirus Restrictions Regulations NI 2021 and recommends that it be confirmed by the Assembly? Are we agreed?
Chair, can I come in? Sorry, it's not just TEO, it's come back to the Department for Health.
Yeah, just to clarify, that is to both departments as a matter of urgency.
Yes.
That's well made. So can I ask the members, are we agreed? Yeah, members agreed, thank you. Item 8 then is SR 2021/97, the Health Protection Coronavirus Restrictions Amendment Regs NI 2021. These SRs provide for some easements of the restrictions. They permit click and collect services. They remove restrictions on movement and allow 10 people to meet outdoors at a private dwelling and allows for the reopening of certain business. The Examiner of Statutory Rules has no issues to raise with this SR. And again, members have raised significant issues today and have agreed to write to both the Executive Office and the Department in relation to concerns we have around the interpretation and implementation of these rules. However, if there are no other issues to raise, I would like to ask members to agree formally that the Committee for Health has considered the Health Protection Coronavirus Restrictions Amendment Regulations 2021 and recommends that it be confirmed by the Assembly. Are we agreed? Yep, members are agreed. Thank you, members. Okay, members, moving on then to item 10, which is in relation to the committee inquiry on COVID-19 and its impact on care homes. 12:34. I'm just going to take a very short break before we come to this item, just to allow members a comfort break, and we'll resume there. 12:34. Could we come back at 12:45, members, to resume on this item of business? Thank you. Thank you, members. Clerk, can you take us out of broadcasting temporarily, please?
This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed.
Sorry, Chair, just waiting confirmation that we're live. That's us live now, Chair.
Thank you. Okay. Okay, members, so we're moving on then to item 10, which is our committee inquiry, which was COVID-19 and its impact on care homes. Can I ask all members to make sure that you're on mute? And if you have a hand raised from the last session, just take that down so I can see hands raised again for the session. So the departmental response to the committee's inquiry report has now been received. A short summary of the department's response is in your table papers packed there at 10.2. Members will have noted that a lot of the committee's recommendations have been accepted or partially accepted by the department. So hopefully members have had a chance to have a look over that. What are members' views in relation to what they have seen there within the department response? Yeah, I see Carol indicating, and if other members, Jonathan, your hand is up. I'm not sure if that's from previous, but I see your hand is up there, Jonathan. So I'll check with you. So Carol, and then I see Jerry. Carol, so go ahead, Carol. Let her dice.
Gormayaga, Chair. So I appreciate I wasn't here when the inquiry happened, but I think we need a bit more of a response back from the department. So, what does partially accepted mean? Why is it not accepted? And basically, some of the issues that just were raised are still, in my opinion, very topical. But certainly, I think just going by the response, it's very scant. And given the brevity of the inquiry, I think we need a bit more information and clarification on that. Chair, it's just my own instinct.
Yeah, I would agree in that I'm particularly disappointed, I have to say, around the discharge policy one. I think that was an area of particular concern for the committee, and I would like to know more about the reasoning behind it. I note the testing one as well. We were looking for further resilience within the local testing. So it may be useful maybe to look at maybe asking for the department to provide a briefing, maybe we could look at doing like a lunchtime session or something to get further details. And I know we're under significant pressure of work, but I think it would be useful to go through the partially accepted as well to see why is it partially accepted, what's partially accepted, what's being proposed in place or whatever. So I think that'll be a useful discussion, but we'll come back to members to see. I do agree with that notion. I'm going to Jerry Carroll.
Thanks, Chair. I would agree with that suggestion from yourself as well. Just a couple of comments. I think the first 6 recommendations they were accepted, but I note obviously the care partner scheme still hasn't been fully implemented. Similarly to yourself, Chair, I'm concerned about some of the answers to the discharge policy, and I think that most of those areas have been partially accepted, if I recall correctly. Also concerned about sorry, bear with me. In response to the answer to the first 6 recommendations, there's a grouping referred to by the department moving towards normalised care home visiting finished group, and there's no union representation on that, so that's a concern. The fact that the department is kind of partially accepting the fact that patients should be tested before entering care homes, again, in another pandemic or outbreak, is very concerning, and to me suggests they're trying to save face from their previous error, and they're unwilling to admit that was an error, which most people have seen that it was. And I think that's something that needs further clarity on from their perspective. And then just obviously just one final point, Chair. The safe staffing obviously is referred to, and I think it's accepted from the department, but obviously there's no legislation coming through, so that's a further concern. And then just the answer to. So there's a lot of recommendations, obviously. An answer to recommendation 38. There's from my perspective, an evasive and a bit of a waffly answer, to be blunt, from the department around inspections basically trying to downplay the role of inspections. And obviously we all know inspections can't find everything, but they can obviously flag, major issues. And then obviously just finally, Chair, the recommendation 40 about improving guidance with unions between care homes. There's nothing really from the department's point of view about tackling owners who refuse to let people join a union or unions end the unionise. So just a few general points on that. Thanks.
Okay, thank you. Jonathan, your hand is raised. Can I check, is that in relation to this section? I'm not hearing from Jonathan there, so I'm going to move on to Pam, whose hand is also raised, and I'll go back to Jonathan. Go ahead, Pam, please.
Yeah, thanks, Chair. I suppose it's good we've got a detailed response from the Minister. That's the first thing, and it does certainly outline a willingness within the Department to accept most of the recommendations. I think as a committee, I would like us to be looking at, putting in some kind of performance framework on this to ensure that there's kind of rolling scrutiny going forward, and that we can kind of tick off which recommendations have come to pass and what hasn't, and so we can keep a good eye on this going forward. I think it's too important to just dismiss as dealt with at this point. I think there's a lot of issues that are too important. So I think we'll have further opportunities in the Minister coming before us again too to ask questions around this for some of the issues we feel are too important to be dismissed or rejected. But I would like to see some kind of performance framework, if that's the right terminology, put in place so that we can just kind of keep an eye on where the department has gotten on each of the recommendations.
Okay, thank you, Pam. And I'm going to check back then briefly with Jonathan. Jonathan, do we have Jonathan online, Clerk? And can you check if his hand is still raised from previously? Which I think is the case.
It's still raised from previous. I think he's just not at his desk at the minute, I think. Okay, members. So there's two, I suppose, proposals there that we asked the department to come and go through in some more detail. The recommendations that have been partially accepted or not accepted as to the rationale with that, and also the Deputy Chair's suggestion there that we put in place a series of maybe review meetings or monitoring in a sense that we can ourselves track this through the implementation by the department, and maybe we can schedule that after we do the meeting with the department to glean a bit more detail at this point. Are members content with both of those suggestions? Yeah. Okay, members. So, and Clerk, that may be the case that we may maybe want to do a lunchtime meeting or something like that with the department just to not disrupt the quite intensive work that we all have ongoing. I think it'll be maybe a useful format for that. Okay, thank you, members. Moving on then to correspondence, item 11. So there's a couple of items, a number of items that I'd like to draw your attention to, and then I will go to members for their comments on any items of correspondence. We'll deal with the main pack first, and then anything that's in table papers, I'll come to a separate and a discrete section on that if members want to raise issues of correspondence that are in the table papers. So the first one that I want to flag today is item 11.2. which is the outcome of the consultation on the establishment of a regional care and justice campus for children and young people. This is a joint piece of work taken forward by the Departments of Health and Justice. The Committee for Justice have got in touch to suggest a joint briefing from officials on that work. Have members any comments, or would members be content with that approach? Go ahead, Carol.
No, just said that's dead on.
Yeah, thank you. And I think all the other members are content with that. So if so, then the clerk will, Clerk, can you kindly liaise with the Justice Committee to identify possible dates for a joint briefing? Yeah, thank you, Clerk. Item 11.6 is the Department of Health's views on the damages return on investment bill. So that's also linked to Committee for Justice. Have members any comments in relation to that item? No. Okay, are members then content to write to the Committee for Justice to outline that it is content with the Department's response? Yeah, thank you, members. Item 11.7 is a response from the Department to the Committee's request for further information following the briefing on the hyponatremia-related deaths work programme. Have members any comments in relation to this item?
Chair, sorry.
Go ahead, Carol.
This is in relation to the Perm Sec coming in front of the committee, is it?
Well, that's a separate item issue. I think, Clerk. Can I just check that this is separate to the briefing from the Permanent Secretary?
Sorry, Chair. This letter just is a response to some of the issues that were raised, and it mentions the Perm Sec. So the next line of the brief was just a outline that we scheduled that briefing for the 27th of May.
Thank you.
Okay, so members therefore content to note pending that briefing that the Clerk has confirmed from the Permanent Secretary on the 27th of May. Members content to note in the meantime. Thank you. Item 11.14 is from the Children's Law Centre regarding the Department's proposal to extend some of the provisions of the Children's Social Care Coronavirus Temporary Modification of Children's Social Care Regulations. Members will recall that the Department advised that it's carrying out a brief consultation on this proposal, and that the committee sought the view of, we also separately sought our own view of the Children's Law Centre on that matter. So any comment from members in relation to this? I was wondering in relation to this, would members be content to be right to the Department to request that this regulation comes in as an SL1 in the first instance? And I think this, where people are particularly vulnerable, I think in relation to children's regulations, and we have welcomed some of the improvements in relation to the mental health regulations, but I think these key ones in particular would benefit from going back to a more normal process so we can engage properly with the Department. So would members be content in relation to the children's that we request that comes as an SL1? Go ahead, Pam.
Yeah, Chair, thank you.
Members are indicating agreement. Go ahead.
Yeah, I wouldn't disagree with that. Are we going to send this letter off to the Department for them to get that detail as well, so that they can answer some of the concerns that have been raised?
Sorry, Pam, just can you clarify that? I didn't quite pick up what you're asking there.
Yeah, I'm just wondering, are we going to be forwarding the letter to the Department?
Okay.
So they can answer some of the concerns raised as well?
Yeah, absolutely. I think I'd agree, and I see a lot of members agreeing as well. Yeah, so we'll forward the letter to the Department and ask them to respond to the concerns raised. Yeah.
Thank you.
Okay. Thank you, members. Are members otherwise content then with the main, any other proposals? Yes, go ahead, Jerry. Yeah.
Thanks, Chair.
And Carol next.
Just Chair, on 11.3, the correspondence from the Minister releasing the Solace and Kids Together, a group in my constituency. And it's just, I find that, the answer is quite short and disappointing in some ways, because it basically says that the organisation isn't getting access to community and voluntary sector funding this year, but there's a new stream next year. And given what we've heard about all the pressure on the community and voluntary sector and organisations and the challenges they face, I don't believe that's good enough for this and other organisations who are falling outside the remit of funding. So just to express my disappointment on it, I've no proposal necessarily around it, but I'm happy if others do. But I don't think that really deals adequately with what this organisation needs, and it's a very important and worthwhile organisation, as many others out there are.
Thank you, Jerry. And going to Carol, and then Paula.
Yeah,
go ahead,
Chair.
Carol.
Yeah, Chair, thank you. I would support Jerry's call, because the Kids Together actually deals, right, maybe based in West Belfast, deals with kids from right across the boards. And you may remember I raised this before. But one of the other issue, and I don't know what stage it's come at, Chair, so apologies, I've had a bad IT malfunction. But I want to come back to reproductive health care for women in the Western Trust as well, about the withdrawal of some of the services. So I don't know what stage. I'm just looking your guidance here, because I'm trying to look at papers on my phone and I'm not having much success.
Well, if we bring that any other business, maybe we'll raise that in any other business then, I suggest, and we'll complete the correspondence initially. Okay. Okay, that point is noted in relation to the concerns around Solace and Kids Together. Any other items of correspondence in the main pack that members wish to raise?
Sorry, Chair, I was to come in on
Paula,
that.
yes, you were indeed, Paula. Sorry, go ahead.
I was just going to echo, Solace operate in South Belfast and they provide amazing services to families and the young people, and I thought that it was a bit of a sweeping bat away considering how much they have contributed and what they put on during the pandemic. I mean, I think it was quite insulting actually, the response. So I'm just not sure what we can do as a follow-up. A year away, some of these organisations, especially Solace, they may have to close down some programmes because they don't have the grant fund. I think they've probably 20 live grant funds and no organisation should have to deal with that. So I would like to go back around to try and get a bit more clarity on what funding the department is providing for autism services in the community and voluntary sector, because I don't think that was a good enough response given the need, the acute need across the city and beyond.
Yeah, so members content to, I think we actually have, I'll just check with the clerk, we may have a detailed request in with the department already around autism, but I'm not sure if it includes community services, so I'll just check with the clerk on that.
Yes, Chair, we do have a letter in, but we can follow up on that particular issue and ask for, I suppose, a fuller response.
Okay, so members content with that? Yeah. Thank you, members. Okay, and then any other items of correspondence that members wish to raise or draw attention to? No, thank you. So, are members then otherwise content with the actions proposed on the correspondence memo? Yep, members are content. Moving on to table papers then, the table pack contains a number of further items of correspondence, and I would draw members' attention to one of them there, which is item 11.49. That is correspondence from an individual on a public interest disclosure in relation to the Western Trust. The committee had previously written to the department on this issue and were content with the response received in December 2020. Are members content to note, or have members any other comments in relation to that piece of correspondence? Members content to note? Yeah, okay, thank you. Moving on then to the Forward Work Programme, I refer members to the draft Forward Work Programme at tab 12.1 of the pack. Are members content to note the Forward Work Programme as presented there? Yep, members content. And just, I want to draw attention to a Mental Health Week, which is the week after next. We have a very, I think, important programme of events lined up and a very important focus, actually quite timely in a sense, that we have a very important focus on children and young people, given the issues around autism that have been mentioned today, given the issues around CAMS that have been mentioned today, and indeed community services, all very much trying to address this significant and worrying issue. So if we could just ask maybe the clerk to outline the draft programme for that week, so that members have a kind of a steer on what we have arranged for the Mental Health Week. Go ahead, clerk, please.
Thanks, Chair. Just to outline what the plan is for that week. At the minute, we've got a committee motion promoting Mental Health Week. At the start of that week, I've just confirmed the day, whether it's going to be the Monday or Tuesday. Then the formal committee meeting on Thursday, we have a briefing from the Minister on mental health, and then we have a joint briefing from the Children's Commissioner and from the Mental Health Champion. We then have a number of informal events. I will get the dates and times issued out to you. On the Wednesday evening, our engagement team have put together an event with young people from a number of different groups to discuss mental health and well-being. And then we've two other informal sessions, likely to be Wednesday morning and Friday afternoon. One is with the 123 GP group, which is about mental health services and GP practices. And the other is with the mental health policy group, which is a group of 4 different organisations: the Royal College of Psychiatrists, the British Psychological Society Northern Ireland branch, Inspire Wellbeing, and Action Mental Health. So we're still finalising when they will come, whether it's on the Wednesday morning or the Friday afternoon, but I will get that calendar out to you. Also, it was mentioned earlier about the possibility of getting the trusts along the brief. So I will have a look at that and see what we can schedule. If not, certainly that week, as close to that week as possible. So I'll get that issued out to members after today, just so you can start checking your diaries for those events. And I will confirm the date of the committee motion as well. It's, like I said, it's likely to be hopefully Tuesday the 11th. There might be a chance we might have to do it the following week, but we're hoping that it'll be on Tuesday 11th of the week of Mental Health Week, or Mental Health Awareness Week, sorry.
Okay, thank you. Any questions on any of that, members? No. Okay, thank you. And thank you, Clerk, and thank you to the entire team there for pulling all that together. There's a substantial piece of work involved there. I have to say, I'm particularly looking forward to the engagement with young people directly. I think that's a really great opportunity for us to hear directly from those young people about the impact all of COVID has had and lack of provision and access to services is having more generally. Paula, I do see a hand raised there from yourself.
For any other business, please, Chair.
Okay, so yeah, I think members are content with that mental health. So moving into any other business, and Carol, you have raised an issue there. Go ahead, and then I'll go to Paula.
Yeah, sure. It was just, if there's removal of any other services by any trust, there'll be an explanation. So I just think we need to, it's completely appropriate for this committee to ask what is happening with those health and social care services for women in that trust area.
Okay. And would you be that we write to the trust and the department asking for an explanation as to that and what is being done to address? Is that the proposal? Are members content? We right?
Content, Chair.
Content, yeah.
And Paula, then go ahead, Paula.
Thank you, Chair. Like many others on the call today, I've had my first vaccine and the system went really well. But unfortunately, one issue has been brought to my attention, and that was from a constituent who requires his communication to be provided in Braille. When he went along to the vaccine centre and asked for the information that those of us had a vaccine, could he have it in Braille? He said it's not available. And he was a wee bit annoyed and upset, and he said, he sort of raised a complaint, and he said, well, I'd like to issue a complaint or submit a complaint. And so he was offered some correspondence or a leaflet that was just in print. So I suppose it's something that we could maybe write to the department and raise this issue that there will be people coming forward for the vaccination who have sight loss and require the information in Braille. Chairman.
Yeah. Thank you, Paul, and that's useful. And I wonder, could I possibly add to that a concern that I have encountered across a number of areas and a few people that we're working with in relation to access to guide dogs for the blind and other services for people who are sensorily deprived as a result of COVID. There's been a horrendous. I wonder, could we include in that asking the department to outline what additional supports they are putting in place to protect people in light of the impacts that there have been.
Sure.
Yeah. And the clerk has pointed out that we will have Patricia Donnelly next week as well, so we could raise the issue. But I think it's worth writing on both those issues, and I think the committee are in agreement with that. Jerry, go ahead, Jerry.
Yeah, just following on, because I don't think I've received the correspondence. Apologies if I have, but can we as a committee ask for is the Royal Society for the Blind, is it, if that's the correct organisation, or whomever it is, to find out sort of what challenges they face? Because I was kind of a similar issue that Paula was raised with myself. Not too sure if it was the same case or not, but I imagine people who are blind and partially sighted have a lot of difficulties, but I haven't really had much correspondence from the organisation. So if we could maybe go out of our way as a committee to contact them, I think that would be useful if we can.
Yeah, because I am aware that there are a number of issues where working dogs have reached the end of their working life and have had to be removed from the assistance of the blind person, but nothing has been in place to. So I think that's a useful engagement. We could ask them to illustrate and amplify any of the issues that they're encountering, and then we'll at least have some awareness of that. So, Clerk, if we could ask the Royal Institute for the Blind to give us a written briefing on relation to their issues. I think that's the proposal.
Chair,
yeah, Carol?
And I know it's slightly different, but it's still problematic. Could we ask about singers and support for the deaf and partially hearing as well? I mean, I went to the SS Arena, and I have to say it was absolutely fantastic the way the layout was. But I could see if there were people had different challenges around their hearing, it would be difficult for them.
Yeah. No, my proposal was actually we ask around all the sensory deprived areas. I think it'd be useful if the department could give us some indication on how they're supporting those people. Okay, members. Pam, go ahead.
Thanks, Chair. Yes, I also wanted to speak to the deaf community as well, and it's something they've actually written to the Speaker in the Assembly as a subject as well, because obviously for the deaf community, their English is not a first language. So I mean, I think I've had much communication with the deaf community in my constituency, and it's actually very, very difficult to communicate, even in the written word, because English is not a first language, signing is. So it requires interpretation even on a constituency side of things, in terms, and it is very, very difficult. So there's much frustration out there about the lack of provision to very basic communication that we all need, especially as we're going through this pandemic. I think it's really highlighted how little there is in terms of real effort to communicate with people who have no other way of getting that really vital information, and that's across all the departments. So I think it's a much bigger subject. So I'm glad we are talking about it today, and I think it's appropriate that we do try and act on that.
Yeah, thank you, members. I do think that is a useful and a very a crucial area of attention for us. So thank you for that. Okay, members, thank you for today. Just moving on to date, time, and place of our next meeting. Our next meeting will be on Thursday, 6th of May at 9:30 a.m. via video link. There has been an email circulated to members. I had asked the clerk to prepare a discussion document around the virtual and the impact of virtual and how we can better manage that in light of and in respect of both abiding by the restrictions and regulations, but also demonstrating good practice ourselves and applying that good practice to ourselves as well. So I'd asked the clerk to present a sort of a discussion document for you all, and that has been emailed out to you. So thank you, clerk. Thank you to all of the clerking staff. As ever, it doesn't always get said, but we always do appreciate the work that goes behind every one of these meetings in terms of preparation and follow-up, which is massive as well. And once again, this has been a very heavy meeting in that respect. And the clerk and his staff then have to deal with all those additional requests. So we appreciate that, and I want to pass that on behalf of the committee. So thank you, members. Next meeting, Thursday, 6th of May at 9:30 a.m. via video link. Gorma Agav Agus Begi Slam. Take care.
This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber Programme signed. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme sound. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. This is the Northern Ireland Assembly Senate Chamber programme signed. Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29. This is the Northern Ireland Assembly Committee Room 29.